Good morning and welcome to the second edition of Gratitude Week, a tribute to our health guardians. I am Kamal Narayan, CEO of the Integrated Health and Wellbeing Council, India's premier institution for health awareness, advocacy, and behavior change. Gratitude Week has been an incredible journey for all of us. It began last year on the National Doctors' Day to honor the life-saving services of healthcare workers. Despite all the challenges posed by the pandemic, they continue to work hard in hospitals, labs, pharmacies, and even in medical plants fearlessly and selflessly. In the past 1.5 years, more than 4 lakh Indians have died due to COVID-19. According to Indian Medical Association, IMA, this toll included more than 1,500 doctors. However, the overall loss for our healthcare ecosystem might have been much higher, as the sacrifice of many others working at several fronts of the healthcare system and supply chain might not have gone in any specific register. We cannot thank them enough for their supreme sacrifices. Still, with humble initiatives like Gratitude Week, we endeavor to create a common platform for all Indians to share their feelings and show their thankfulness. This year's journey was kick-started by none other than the Union Health Minister, Dr. Harshvardhan. Since then, in the past 5 days, we have been joined by a galaxy of luminaries, including doctors, specialists, medical educationalists, hospital administrators, industry bodies, lawyers, social activists, and humanitarian workers. They not only highlighted the contributions of the healthcare workers, but also discussed some of the most pressing issues related to their work and the challenges before our public health system. We conclude each day with a rich musical tribute to all health heroes through live performances of artists and troops from schools with extensive participation from the general public. So before we continue with today's program, here is a quick recap of the journey of the Gratitude Week so far.
History shall bear witness that when the time came and humanity needed to be saved, it was the doctors who stepped up to answer the call of duty.
WHO के द्वारा जो ये आपने डॉक्टर्स डे पर चिकित्सा दिवस पर इस कार्यक्रम का आयोजन किया है, मैं आप सबको हृदय की गहराई से आप सबके प्रति आभार व्यक्त करता हूँ.
Congratulating the Integrated Health and Wellbeing Council for this unique gesture to honor the doctors and other people in the medical community who are the most dependable resources to fight this pandemic.
7 दिनों में भाग लिया है, तो सभी का मैं धन्यवाद करता हूँ. डॉक्टर डे के अवसर पर दुनिया के सभी डॉक्टर को, भारत के सभी डॉक्टर को मैं शुभकामना देता हूँ, हार्दिक बधाई देता हूँ. जय भीम, जय भारत.
I would really say the doctors have actually risen to this challenge in this unprecedented times, and that is something which is very heartening, not only in our country but at a global level.
We got to get together to support a true legislation and a strict legislation of against assault to doctors.
We need to be really serious about and have a rethink about the final delivery system we need to adopt.
It is duty of various actors and various stakeholders to make sure that the accurate information is readily available to people who are looking for them.
By communication, having compassion, having empathy, feel the pain of the other person.
Having said that, have 3 attributes: sympathy, empathy, and compassion.
There is a lack of empathy. There are other issues that many times the doctor is helpless.
Younger population is definitely, active. That is why they are more exposed to infection, and we cannot say that they are less or they are going to be in future.
So definitely there has been an improvement in the number of stroke patients coming to the hospital, but it has not still reached the pre-COVID level numbers.
What COVID did to especially India, one, it disrupted the NCD services totally. The second most important thing it has caused.
We need to talk to actual people in the Center for Disease Control, the virologists, people like you who are on ground. We need to understand and fight this scientifically.
Yes, the fear is still there, but as I said that the passion is to hear one day that India is a developed nation.
खूब लगा लो पहरे रास्ते रब खोले तू न जाने आस पास है खुदा Today, we are on the 6th day of Gratitude Week 2021, focusing on the role of a larger healthcare ecosystem that is normally ignored. While our heroes in wide deliver care at hospitals and health centers, or what we call as frontline during this pandemic, there are millions of unsung heroes who are working at the background for discovery, development, production, and supply of all that these frontline workers need to restore the health of patients. These are our scientists, pharma workers, medical device makers, lab technicians, pharma supply chain workers, and even chemists and many others. Today, we are celebrating their role in helping us tide over the gravest public health crisis and also in assisting us in protecting our health from many other visible, invisible epidemics our country of 1.36 billion people face. Today, we will be celebrating their role in helping India to become Atmanirbhar for its healthcare requirement, but also made it pharmacy of the world, catering to the health needs of billions of people across the globe. And we will try to see how the pandemic became an opportunity for India to elevate from a manufacturing hotspot to a powerful country riding on its science and technology prowess. And most importantly, we will also hear how our industry is preparing for the subsequent battles of this long-haul war against COVID-19. So without any further delay, let me welcome the towering leaders of India's healthcare industry who have joined us today in this panel. So welcoming Mr. Gagan Singh Bedi, Managing Director and member of the board of AstraZeneca Pharma India, a pharma industry veteran. Mr. Bedi has also served as the global head established brands at AstraZeneca PLC and was president of AstraZeneca Philippines. Before joining the British drug maker, he worked with Eli Lilly, Ranbaxy, and Baxter. An MBA from the Faculty of Management Studies, Delhi University, Mr. Bedi is also director on the board of OPPI, the apex body representing the research-based pharmaceutical companies in India. So welcome, Mr. Bedi, on this inaugural session of Gratitude Week 6th day. We also have with us Ms. Ameera Shah, the promoter and managing director of Metropolis Healthcare. Under her leadership, Metropolis has grown to become India's largest and only multinational chain of pathology labs and diagnostics. Named amongst Asia's most powerful women in business by Forbes Asia and 50 most powerful women in business by Fortune India, Ms. Shah is recognized as a global thought leader in the healthcare industry and a strong advocate of compassionate universal healthcare. We also have with us Anirudh Rajurkar, Chief Executive Officer of Shield Healthcare. Anirudh has a successful career of over 22 years in general management, sales, marketing, and functional leadership experience in pharmaceutical industry. He has held positions of increasing responsibilities in the pharma and healthcare domain, and he has a strong and diverse background with leadership experience in highly competitive and regulated markets. We also have with us Jotin George, Senior Vice President, CIPLA. Mr. George is currently leading multiple business units at the Indian multinational pharmaceutical majors, along with critical role in driving business at oncology, critical care, nephrology, rheumatology, and also through alternate channels of hospital, government institution, and market access. He is also playing an instrumental role in setting up the diagnostics business in CIPLA. During his nearly 3 decades of experience, he has worked with global brands like Roche and GSK. So first of all, let me thank you all our panelists, esteemed guests today who have joined today on this panel and have strengthened this initiative. And also we place a sincere gratitude to all of you and the people working with you for their wonderful work during this crisis. And actually, this panel comprises a very unique mix of, and I think it's a kind of a dream panel. We have somebody whose company has been instrumental in for getting this humanity one of the earliest vaccines from this COVID-19. We have somebody who has done wonderful contribution in the area of testing and diagnostics of COVID-19. And we also have a company representative which has tried to bring as much therapeutic support as possible. And also somebody who is taking care of another very important aspect of Indian healthcare, which is the health of our women and children. So thank you so much for joining, all of you. And let me begin with you, Mr. Bedi. Last 15 months has been a time when decades have happened. And would you just like to, kind of rewind those time and how your company kind of moved leaps and bounds to ensure that we are getting enough protection, enough shield for humanity against this pandemic?
Thank you. Can you hear me well, sir?
Yes, sir.
Thank you. First of all, Kamalji and everyone on the panel, very good morning, and thank you for welcoming me here. And a big gratitude to everyone who's listening. I don't think in our lifetimes, there's been a bigger crisis that all of us have faced. And I'm really proud of the way, we as an industry, along with we as a country have responded. As I speak to you, with 360 million, 36 crore vaccination. It depends. It goes a big compliment to the industry, to the healthcare workers, and the government itself for one of the largest programs on vaccination that has been put together. So a big gratitude. I think one of the aspects that you touched back upon, 15 months and living through decades. I think the biggest pride that I have when I look at the last 15 months is that as healthcare sector, we have not left a single patient behind. Braving is at some point of time, including lathi charges. There have been workers who've reported into factory to make medicines. There've been distributors who made sure that vaccine is available, and chemists who walked miles to make sure that drugs are available. While we talk a lot around COVID patients, but we also forget there are a whole dependent set of patients in oncology and other areas as well who required attention. And and a big salute to people who've continued to serve. And over the year that I've interacted with so many forums, I've never heard a single patient complaint of being left behind. So I think a remarkable effort with everyone, and that kind of shows that together, what a power we are. Specific, sir, to your question on our response to COVID, I'm really glad to share with you. We moved very early. Last year in April, we tied up with University of Oxford for global development, production, and supply of their potential vaccine. Very clearly, our philosophy was equitable distribution and not for profit. Equitable distribution meant that we had to very quickly scale up because we knew, the scale required in vaccine here, it was unprecedented and no single company would have had. And in 6 months' time, by middle of around October, we had tied close to about 3 billion doses across the globe, with the number one partnership being with Serum Institute, where we tech transferred our technology to them and ensured that over 1 billion doses were potentially possible in a single year. We signed up with the COVAX to make sure that over close to about 200 million doses will be contributed. We had our own capacity of 1 billion, and the additional billion we tied up in places like Korea, Thailand, Brazil, and Russia. So all in all, we were pretty much ready. And all of this did not happen sequentially. All of this happened parallelly. So while we were conducting clinical trials, we kept on making sure that these capacities were ramped up so that come December or January, when we received the emergency approvals in countries, we were ready to supply, like you've seen in India as well. And through COVAX, now we made it available in 160 countries, this vaccine. Our effort does not stop only at the vaccine. We're further studying opportunity areas in long-acting antibodies as well, which is under study, and very shortly we'll be sharing that also. All in all, I think these times required unprecedented solutions, and I'm proud of the fact that the company, through its collaboration, through its values, made sure that vaccine was available at an appropriate time and widely equitably distributed, as well as affordable. Thank you, sir.
Thank you so much, Mr. Bedi. And really, the point which you made, that the entire industry and the entire healthcare provider, fraternity tried to not leave any patient behind. And I can see that and that is what I was mentioning, that when we are seeing COVID-19 as a important and very kind of emergency challenge in front of humanity or our country, we also face a lot of other epidemics, and all which are as grave as pandemics itself. For that matter, the cancer, which has killed more people last year than the pandemic across the world, and wonderful to see that company like yours is continuing that. I was seeing that the approval of the new drug for AstraZeneca for the lung cancer, and that shows that nothing was left behind. So let me go to, at this point, Ms. Amira Saab. Ms. Amira Saab, we saw the last year's ill preparedness, or for that matter, we were taken by surprise for that, when the first wave of COVID hit India, and we tried creating all that possible resources, and the whole philosophy of Atmanirbhar started, and you people definitely tried to make the country Atmanirbhar. But the second wave again, kind of exposed many of those faltering lines. How, and at the same time, the providers like yours, who are now holding a capacity of maybe 25,000 RT-PCR per day, or maybe more than that. How did you, kind of put together the entire this ecosystem? What it took, and were at any point of time your teams, your people were kind of afraid not to go out and do that what they were doing? How did you kind of manage all that?
So, being in the services area, firstly, like Mr. Bedi, I just wanted to congratulate all of healthcare and all the workers and leaders who, it's been an incredible year. It's been a very challenging year, not only from a supply chain, physical restriction point, but also from a very emotional perspective. I mean, I know all of us as leaders have felt sandwiched at many times between government policy, which has been obviously changing continuously, and health being a state subject and a district subject and a municipal corporation subject. Rules have kept changing in every small corporation on a every weekly basis. And I think with that, to have our employee health on one side, our customers on the other side, government on one side, I think we all, the best word I can think of, felt emotionally sandwiched and have had a very, 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 very challenging year. Having said that, while I do definitely see the positives of all the things that we've managed to do as a country, I think it's also at the same time very important that we don't let our guard down. We got shocked in the first wave. I'm not sure why, because the whole country was going through COVID, and there's the blood of Indians doesn't spare us corona, and therefore we could and should have been better prepared as a country. And I mean that with public and private all together, to be able to have projected numbers, forecast numbers, to know exactly how we were going to move forward. And I think we could have had, the first wave, we could have been more prepared for it. And definitely, I think after the first wave got over, the expectation that we are done and we are dusted and therefore nothing is going to happen to us now was, as we all know in hindsight, definitely not the reality. We had many, many months to actually prepare ourselves in terms of infrastructure. And my only concern is that while the only thing that's going to protect Indians from a third wave or a fourth wave is going to be mass vaccination. And as we are trying to, rocket forward on getting as many people vaccinated, the reality is we have 1.3 billion people in our country. And we don't have that many, while we have given 360 million doses. Very few percentage of those are fully vaccinated, unfortunately, fully vaccinated, right, with both doses. And therefore, we are still not at a place where if the virus comes rushing at us, we can protect ourselves with this barrier of vaccination. In my mind, that logically and commonsensically means that we are in for a third wave. And in the third wave, as rightfully said by many health experts across the country, the people who are going to get hit are going to be the ones who were not hit before. The ones who had not got corona, the ones who are not had vaccinated, and which we know is 40 below. And therefore, if children are going to get hit, if the young population is going to get hit, are we prepared for the third wave is my question. Have we put out checklists to all the hospitals saying that these are the kind of instruments that you need to get in place? Because, for example, pediatric ventilators are very different from adult ventilators. The number of ICU beds needed for pediatric are far fewer than the number of ICU beds required for adults. We have much fewer capacity in the country today. So I still think we have the time now to prepare ourselves for the third wave, so we are not shocked again and not sitting in a position that we again feel, we could have done it differently in hindsight, because lives cannot be lost more. If we have to take every Indian along, every Indian, whether rich or poor, whether living in Delhi or living in a small town of India, has to have equal value in our lives. And for that, we have to be more prepared for the third wave, which at least I believe is going to come. And for us as healthcare leaders, the real challenge is to keep the motivation of our teams and to keep them motivated to keep taking care, because the kind of work healthcare leaders and workers have done this year is just phenomenal. I mean, to work 14, 17, 18 hours a day with your pressure of your own security, your family pressure, to take that risk day in and day out, to deal with patients, to deal with the wrath of families, to deal with the pressure people put on you, and to change with the changing environment every day is incredible. And we have to keep our teams motivated. To me, that is the single most important thing, along with readiness of infrastructure, that we must do for the third.
Thank you so much, Ms. Shah. Very important point, and that is what is the, take me to the next question also, that while so far it has been, so good, and at the same time somewhere bad also, but what lies, ahead. By requesting two other panelists to wait for a few more minutes, because Mr. Bedi has said that he has to leave at 11:30 sharp. So I just want to get one more time him in the discussion. And Mr. Bedi, when Ms. Shah is saying that the preparedness for the third wave is something which everyone has to do, from the government to the sector industry, and even we need to prepare our people, the healthcare provider, and they are also getting exhausted. We need to kind of reinforce that force. What lies ahead? We see that around 35 crore, which she said that around 360 million vaccinations have happened in India, which is not fully vaccinated, and the fully vaccination may be around hardly maybe 6 crore out of it, or maybe 6-7 crore out of it. How do you see what lies ahead, and what is your recommendation for the industry and the government as well, to kind of I'm especially driven to ask this because I was hearing the speech of Boris Johnson this morning. Maybe it might have been delivered yesterday, and he was saying that all those restrictions are going to be lifted. And I think whatever he was saying was only because that the country has got a very high level of vaccination, which is like ages from now for us, as it sound like. What is your recommendation?
Thank you. It's a very pertinent and important question. I can't disagree that we do have a challenge coming up there, but just a couple of nuances I'd like to put in. First and foremost, remember, a lot of people last year used to ask me, "Aapko to vaccine mil gaya hoga?" As if I was like queuing up as the first volunteer in the clinical trial. And I should always remind them, "Ki saab mujhe mil gaya hai, and my vaccine is called mask. My mask is my vaccine." And fortunately, some of us who've remained protected with God's grace, and frontline workers as well, who worked very closely with COVID patients prior to getting vaccinated also, owe it to the mask. So I think if we can continue to have COVID appropriate behavior, that is a given. Yes, we are not a country where it comes natural to us, but that's what something I think all of us need to emphasize on. Coming to the point, there is enough and more data coming out. Last week we read out our data, 45-week data on the vaccine, which clearly shows that how efficacy is retained even after dose 1 for 45 weeks. So I think while having a full vaccination is the best solution, but even now having one dose being given to a large population, particularly if they're economically productive, is going to be really, really important and play a big part. The third aspect, which I believe is ramping up this capacity, and this does not just mean the existing manufacturers, but I think the approvals coming through for Sputnik, we've seen for Moderna, hopefully sometime for Pfizer, J&J as well, could help in augmenting the supplies. And all of us can relate with this. If you today see in a metro, getting a slot is not as difficult as it was a few weeks back. And I'm sure as we move forward, we'll start seeing it in tier 2 towns as well. So I think I'd just like to kind of conclude by saying, let's remind ourselves on 3 things. One is COVID appropriate behavior, speeding up the vaccination, even first dose is helpful. And lastly, while borrow from what Amira said, and very important is the lesson wave 2 taught us is you cannot be complacent. We need to have stocks built up, whether it comes to remdesivir, whether it comes to tocilizumabs, even at the cost of over-investing. We need to have COVID centers ongoing. I'm glad the state I live in, Karnataka, has decided to maintain the COVID centers. We need to continue to do that. And a very important nuance which Amira brought out, that what are we doing to tailor this to treat a large unvaccinated population, which is the pediatric population. So I think if all of us put our brains together and our will together, even if we can't avert this, we can at least not make it as big as what wave 2 was.
So how soon we can think about Covishield or Astra vaccine getting for the pediatric population also?
Unfortunately, we'll have vaccines for pediatric. It may not be Covishield because not conducting trials there, but I know, having read through media, that Covaxin is undergoing trial, as well as Zydus, which is the data which has gone in, does have pediatric data. So I'm also praying. I have two young children who are eligible for vaccine, that some of these data come out very positive and we have access to vaccine there.
Thank you so much, Mr. Bedi, for your time and for highlighting these very important points. And I'm sure the kind of contribution your organization has done, I think out of 35 crore, maybe 70% of the vaccine might have been from Covishield. So that's the wonderful contribution. Thank you so much for joining us, and we look forward that you will continue to make sure that no patient is left behind for any disease. Thank you so much. So let me now go to our other panelists, and Anirudh ji, I will be coming back to you and we'll talk about the women health. But since Mr. Bedi has highlighted one important point, that are we building up the stocks of those medicines which may be needed if the third wave hit. And at this point of time, Mr. Jordan George, your company has from remdesivir to favipiravir to even building up the capacity or bringing resources for diagnostics, and now this monoclonal antibody cocktail. You have tried to continue to bring some kind of therapeutic intervention during this time of pandemic, and especially towards this second wave. How do you see this moving ahead, and what are and we have seen those scarcity. If the third wave comes, what is our preparedness?
Yeah, first of all, as other panelists mentioned, I would like to thank every healthcare provider, and my gratitude to everyone. And thank you, Kamal and ISW. Can you hear me?
Yeah, please, sir. Yes.
Yeah, for organizing this program. Last year also I was part of your panel, and I really appreciate this. This type of discussions will really help us to have better planning and preparedness. On specific to your questions, second wave was unprecedented. And if you look at overall morbidity and the challenges which we faced was because of lack of preparedness or a prediction. Because of that, you might have seen unprecedented demand of oxygen, remdesivir, tocilizumab, and we were not able to scale up immediately because this all required a lead time of 30 to 60 days and even 90 days for an imported medicine. So I really take this opportunity to appreciate Government of India and my industry partners, because in the month of April, the production capacity of remdesivir was approximately 30 lakhs. And because of these interventions, because all the ministries, External Affairs, Ministry of Health, and Department of Pharmaceutical together intervened and helped us to get the raw material imported, API imported, and 7-8 companies together scaled up the production to 1 million. So you might be seeing by mid of May, most of the scarcity of remdesivir is being solved, and this can be seen in our overall mortality reduction from wave 1 to wave 2. Now we are on a significant reduction in mortality. But our challenge is, again, if you consider third wave, is how we will prevent the hospitalization, because the healthcare infrastructure is having a very big difficulty when you have a sudden surge of patients, which we cannot able to restrict once there is a wave or a mutant variant come. So what we need to get prepared is, this time is, as Mr. Bedi also mentioned, today we are in a lean period, the cases are down. So using this lean period to scale up, buffer stocks and safety stocks. So here, the first initiative is taken by Government of India. 50 lakhs of remdesivir is being procured and distributed to state governments, and it is being supply. So that is a one set of buffer stock, and I am sure government will work further in terms of providing more adequate safety stock in the government sector. Asked to be to the private sector also, so that the private sector also will be able to stock, and corporates are also can have their own adequate infrastructure to keep this buffer stock, because any sudden spike we need 30 to 60 days to scale up the production or import this technology. Third part is, as you mentioned, about the monoclonal antibody, because in last 1.5 years, there are a lot of new drugs comes in, and we have evidences coming that, we can also treat. One is most important, vaccines. You have to vaccinate as well. So I'm not coming to that topic anyway, which is covered. But what else we can do if somebody get COVID? How can we prevent them through hospitalization? So that is where the game change from the monoclonal antibody coming. So monoclonal antibodies, which are recently approved in US and Europe, and now it is approved by BCGI in India, which is a cocktail of monoclonal antibodies, which will be neutralizing all the variants of viruses. But what is the challenge? You need to use early. You need to use this as early as possible, especially for high-risk patients, because they will get chance to hospitalize. So if you use that early for high-risk patients, your reduction of hospitalization can be 60 to 70% as per the data. So these type of interventions can help us to minimize the morbidity, because once you get hospitalized, the usage of steroids, usage of other drugs, we can create more comorbidity like mucus, fungus, and other issues for the patient. So post-COVID syndrome can be a big challenge for the patient. So these are the interventions we should plan for the third wave.
Thank you so much, Jatinji. I think it's the what you are talking about, that antibody cocktail. It seems to be a promising drug, and especially for preventing the kind of deterioration of the condition of the patients, and also provide is preventing the hospitalization. This seems to be an interesting kind of therapy, and we will come back to you a little bit to understand more on it. Let me get Mr. Rajurkar now on the discussion. And Mr. Rajurkar, this is my favorite topic, because all along this last 15 months, while we were talking about COVID-19 now and then, we were definitely talking a lot about how we are ensuring that the care continue to reach to the people for other diseases, and especially for our women and child, because you can't stop child births, and that we have so many of them happening in our country. And it is very, and the overall condition of women health has been really, I think, worrisome. So how did you and your company made sure that while a lot of attention, even including of the government, goes completely towards COVID-19, this very vulnerable segment continue to get what is important for them?
Thanks. Thank you, Kamal. First of all, expressing my gratitude to IHW, Kamal, and the healthcare workers, which have saved us through this second wave, which was quite drastic. Speaking about unsung heroes, as you said, and many of them are a part of our family, the companies and the industry we are part of. This was a time when people went through personal emotions, as Amira was saying, sandwiched between personal emotions, professional requirements, and the challenge of executing whatever we wanted to provide. Was a triad which most of us went through. And it takes a while to really understand what's going on in terms of carrying out your operations in these troubled times. And I would like to express huge gratitude to all the industry peers and partners and workers in the supply chain, in the manufacturing, in getting the inputs, what is required, in ensuring the diagnostics, in ensuring the devices, the nursing staff, which don't get the limelight they deserve, which do not really get recognized for the efforts which most of them have put through. making medicines, making devices, making machines operational, making oxygen cylinders available is not a small task by any means. And many of us who have gone through these second wave challenges realized how important and difficult it is. So it's extremely relevant to express gratitude to all those workers and partners which made us to come out through this second wave. And I think the thing we should take from the second wave is to take forward the preparedness for the third wave and the fourth wave and the fifth wave. I was speaking to our Italian partners. They were telling me they are now on the sixth wave, whatever it means. If it is a sixth wave in some sort of a fashion in Europe, although they are open and we see them celebrating football every night, but they are equally prepared for the strike which is going on. So similarly, I think on our part, we need to be much more prepared than what we are today for facing the next waves of this virus. And I do believe there are two more aspects to managing this pandemic than vaccination, medication, and emergency management. And the two aspects which are slightly broader in its scope is innate immunity. All human beings have a relevant innate immunity. How as an industry, how as a company, how as a healthcare system, we can boost our innate immunity? Vaccination, obviously, yes. But vaccination gives you immunity against a specific, for a specific period, for a specific strain, or maybe a group of strains. But as we all know, virus mutates, it's bound to mutate, and it will mutate. So it is important to improve the innate immunity of the population, which brings the ability to fight the virus with or without the vaccine. That's the first aspect of what we have to also look at. And second and more relevant aspect is for the economy to really come back, it's important that the after effect and management of COVID infection is critical. There have been cases where it takes 3 months, 4 months for a person who's economically contributing to get back to his full capacity. As a country, we can ill afford it. As it is, we have fair amount of talent shortage, and when the talent is locked up for a quarter or more than that for its productive use, you can imagine what's going to happen to the economy. So after effect management of any infection is important, more so in COVID, because we are seeing post the huge second wave that the inflammation which sets in the body doesn't subside very easily, and it requires significant interventions from medical fraternity to make it really go down. So these two areas, in my opinion, are more and more becoming more and more relevant as we widen our basket and as we widen our approach to manage COVID. Coming back to your question, Kamal.
Then I will come back to you, Anirudh-ji, just a minute. Then you have highlighted very important aspect. My question was on women health, but you have highlighted very important aspects of the overall COVID management also, and the management of the side effect or the after effect also. And that is very important as well. And what you have said that, the preparing for this is very important so that we can, and I think what is very important coming out from your statements is that we will have to find out a way to live better with the virus, because what is happening that the waves, we are right now thinking about third wave. Actually in Delhi we were considering that as a sixth or seventh wave, because the third wave came almost a year back here. So that is one thing which we will come back and we'll try to understand more. Let me just request Amira ji. Testing has been one of the biggest I think way to mitigate the risk of COVID-19, and which, as in the last question also, I tried to understand, we build our capacity faster. Multiple players worked on it, and your organization as well provided a very important, I think, support in that. But at the same time, the second wave, we saw that even the RT-PCR test, which was the, let's say, gold standard test and very important to kind of identify a patient, become something so difficult to get or to, kind of get the reports for it. As you mentioned that as an industry, we need to also prepare for it. Government must prepare, but the industry also need to prepare, and keeping at least see that, there is a bigger opportunity also. How metropolis is, kind of readying itself for the third wave with the increased requirement of testing, and not only, let's say, on this RT-PCR, but the other easy to access, easy to, establish diagnostics mechanism also. What kind of work you are doing on that area? You are on mute, Ms. Shah. Sorry.
Sorry. You're right. The challenge when you're building up capacity for testing, we have to remember that it is a 45 to 60 day period that it takes to actually expand existing capacity. And if you want to build a new lab, then it takes about almost 2.5 to 3 months. Now, the reason this happens is because all our equipment are imported. All the chemicals we use are imported. And people have to be trained. And approvals have to be coming from NABL and ICMR. So what happens is that every time you want to expand your capacity, it is not as simple as just getting the machine and putting it there. The machine itself has a lag period of about 20 days. And then to get the reagents, to validate those machines. But most importantly, the people have to be trained. Because these tests cannot be just done by normal technicians who are doing a routine blood fasting sugar or a CBC or etc. It's a very different skill set. Now, training these people, you can't train for 3 days and put on a job. You have to put them through a 20 to 30 day training program, get comfortable with the levels of quality, and only then you're able to actually start the lab. And then, of course, you have to do the physical infrastructure, etc. So I think where we have gone wrong, and I think this is not an India situation only, but it's a global situation, is that because we are not able to anticipate the next wave and when it's coming, we are not having time to build up the extra capacity. And the reality is actually, if you look in hindsight, we have that data with us. To give you an example, in the second wave, in the first week of February, the second wave hit Bombay in middle of March or end of March in a big way. But by first week of February, we actually could see the trend line of samples moving upwards. Because we are operating in 210 cities in India, I know daily what is the COVID count and how many samples we are picking up, right? And that can give us a very clear indication of where things are going. So because we looked at those trend charts, we were able to get our capacity ahead, ready of time, and be ready for the wave that came. Unfortunately, the wave that came in 4x the number of what it came in the second wave, in the first wave. And so we had not built capacity 4x, we had built capacity 2x, right? So I think unless public and private work very closely together to take these forecasting models and work together and say, look, let's build capacity in advance. Like somebody was mentioning, you have to stock things in advance. If we don't do that, we can never battle the wave and we can never be ready. So I think that the key answer here is collaboration, projections, forecasting to be really ready. And that's the only way that we are able to make sure. And I mean, this we are talking about in cities. The reality is in states where there are many states in which they don't have private labs at all operating. And it is only dependent on the government labs which are operating to give them results, and the capacities, unfortunately, are not very large there. So there is a large part of the country today which I believe is not really getting tested, right? So often we say, oh, now the second wave is over. The second wave is not over. It is still going on in many states. The only difference is in those states, there is hardly any testing. And therefore, the real numbers are not able to really show up in our COVID counts. So I think going forward, that, like I said, the collaboration, I think, is very, very critical.
So since collaboration is an important aspect, do you see that industry bodies or government is coming out and then kind of inviting people to come collaborate, have a model so that we are better prepared for next wave, or it is yet to come?
I think there has been some collaboration, but I think the collaboration probably needs to be far more frequent and far more with a lot more trust. I think because often, this is an external war, and the war has to be, the right hand and left hand have to talk every day or every week to be able to battle this. And I think unless, that's not happening in the case of the frequency of conversation, the closeness of conversation, the full trust of conversation. We have to be able to share models with each other, forecast with each other. Otherwise, how does anybody prepare? So I think maybe moving from a more reactive to a more proactive stand, and moving from a sort of a gap and a trust deficit to a closer trust and closer collaboration.
So maybe in one sentence, I can say that the government yet need to be proactive to prepare for the third wave.
I actually would not put it on the government. I would actually say our entire industry, our country needs to be more proactive. We were recently talking with, we've seen a lot of proactivism, for example, from Niti, who's also getting involved in managing this. And we see proactive behavior there. And in fact, one of the suggestions I gave was that, look, why are we thinking this is only a healthcare industry problem? It's not. Today, there are captains of ship, for example, there are FMCG companies who are operating in small parts of rural India where healthcare has no access. Please involve them, involve their distribution when you're talking about vaccination, when you're talking about education, when you're talking about different things. Bring in captains of industry from FMCG. This is not a healthcare problem. This is a citizen's problem. This is the country problem. We should engage everybody with all the strengths possible to do whatever is needed. Right? This is not the onus of the government alone. This is the onus of every citizen of India. To Mr. Bedi's point, everybody has to wear a mask, number one. Every company and corporate, we cannot talk about only selling today soft drinks or snacks or oil or whatever it is. Today we are in a crisis. Everybody has to get involved. And it is up to us as healthcare and government to pull everybody in and say, this is not our war.
Thank you so much. Very important message, Ms. Ameera Shah, that it is a war for everyone and everyone has to kind of chip in to make sure that we are putting forward the strongest, I think, front forward. Thank you so much for being with us. And we thank you for all your wonderful work which you are doing and the Metropolis Group is doing. Thank you so much. Let me go to Mr. George. Mr. George, Ameera Shah was saying that collaboration, partnership, people coming together has to be a very important aspect. You were talking about this, the monoclonal antibodies, and which is cocktail, which is, the new thing coming. How did you see that? Are we seeing that the similar kind of collaboration? Okay, with the new therapeutics here, let's kind of see the efficacy. Let's start using if it is a potential drug, how we can push it further, faster. How do you see that? Is it happening, and how does it work?
Yeah, first of all, I wanted to start with something is, as we said, everybody has to use COVID appropriate behavior. That is the number one prevention which we can do. Number two, getting vaccinated. So we are government is initiating, we are doing what best for the vaccination. But ask Mr. Bedi and all mentioned in the panel is that, we have now young people and there are immune breakers. So some of the vaccinated people are also getting COVID. So what is the option which we have? If we wait for people to come to the hospital and treat, then, we have a huge surge in cases. So how this monoclonal antibody, as you said, this is a combination of two monoclonal antibody, which is casirivimab and nivolumab. And as all of you are aware, this virus is a spike protein. They have multiple receptors to bind to the human cells, which is where the human cells, where ACE2 is the cell where it goes and binds. So this casirivimab and nivolumab is not competing. So they go and bind to the receptors of this virus and not allow the virus to bind to the human cells. So that is what is called, it is a neutralizing antibody. What happens? It neutralizes the virus, not to bind to the human cells. So this basically can be considered as a therapeutic vaccine. If somebody is having COVID and is having symptoms, this can neutralize their viruses as quick as possible. That is the evidence which we have. And the clinical studies, as I mentioned, shown that if you use for a mild to moderate cases at an early stage of COVID with the high morbidities or a comorbidities like cancer, hypertension, diabetes, asthma, or any of this, they will have a very, very less chance, that is 70% chance to get hospitalized. So as your question is concerned, government is taken a lot of initiative. They got some stocks to be stockpiled, and so that if there is a wave come, we can prevent. But private hospitals and corporate chains are also taken this initiative. But public is concerned, the awareness is less because it is a new drug. So obviously, it is very much important that we need to create a significant awareness, so that, like example, I can say, after the first wave, we had enough vaccines, but there were a lot of stigma in terms of public to take vaccine. This is Indian vaccine, this is this and all. When the second wave comes, everybody wanted to get the vaccine, and that time we go out of stock. So my humble submission to everyone is, we need to have adequate inventory build up in all the infrastructure and create better awareness, so that if at all a third wave hit us, we should have a better preparation in terms of this medication, because you can prevent hospitalization. So, which is a very, by any chance, if you get COVID, you can prevent of hospitalization. And these are all supported by government. The good thing is, as you said, insurance companies are reimbursing. Ayushman Bharat is getting reimbursed. So it is a single dose of combination, so which is very convenient for the patient.
Thank you so much, Mr. George, for highlighting this, and I'm sure that the public awareness, and I think most importantly, the healthcare providers must start, kind of seeing it as a potential drug, and I'm sure that your company must be putting efforts towards that as well. Anirudh ji, now I will come back to you for women-related issues, and what has been this 15 months like, and what kind of issues you also saw picking up, and how your company is responding to that. That's a very important area. We must continue to protect our women and children. You talked about immunity, innate immunity. That is also an important area. How your company is taking care of all that.
So as we have learned, as first and second wave, fertility, especially in an age group which is 25 to 35 kind of things, and working women, has taken a beat. It is fear. It is driven by fear. It is also driven by lack of awareness, and it is also driven many a times by the economic situation. So we can't solve all these issues at once, but if we have more awareness and more appropriate awareness from the leading obstetrics and gynecologists of the country, it would help to alleviate a lot of unnecessary fears which people carry. There are fears of fertility related to vaccine. There are fears of fertility and pregnancy during this period of COVID, and so on and so forth. Currently, as we know, there is no data to support any of these fears. But it is important that this message is spread around appropriately. And for that to happen, more and more awareness, more and more discussions, more and more forums we need to create. And it has to come from authorities in the field, so that people can trust these areas. And we have done that quite a bit. We are continuing to do that, and we will do our bit to ensure that appropriate awareness is created across.
Thank you so much, Anirudh ji, for highlighting this. And actually, the next session is about how we have built our capacity of vaccine production, but at the same time also how to tackle this in growing myths around vaccine, which is fueling the hesitancy, as you mentioned in some of the cases, that how it is fueling little bit of hesitancy among, let's say, pregnant women or lactating women or many other with a specific condition. But at the same time, as you have mentioned, that there are many other areas which are coming or which the complications which are based on a lot of let's say not actual threat, but out of fear or other calculations. So thank you so much, both of you, Anirudh ji and Mr. George, for kind of being part of this panel. And we again thank you so much for your wonderful work, which you people are personally doing, leading teams to make sure that, all those gaps of healthcare continue to be filled, and you are continue to be, kind of re-innovating yourself, recalibrating to make sure that whatever it is required is reaches to the people at this crisis of, health, and also for many other health areas. And as if I can just sum up that, the highlight of this session has been that what Mr. Bedi said, that, while we need to kind of vaccinate as many people, or let's say all our 18 plus population is around 60 crore, and we are just at around 6 crore for now. We need to move, kind of leaps and bounds to make sure that it is done, and possibly if it can be done before the third wave. As Amira Shah said, that we have to collaborate, we have to come together, partnerships, and not only healthcare or industry or the government, but every possible player, and even the people of our country, because this is the fight for everyone. And also, as brought up by Mr. George, about that there are new therapies coming up. They are experimental, but they hold massive potential as well, because in this fight against COVID-19, this is, the best we can do is to not leave any stone unturned, and try as every possible tool which can be played or which can be used to mitigate the risk of COVID-19. And as Anirudh said, that while we take care of all that, we must not forget the half of our population, the women, the child. They also need to continue getting the best possible healthcare, which is regularly required, and also all possible support to protect them from COVID-19 also, including vaccination. And it's good that the government of India has recently approved vaccination for even pregnant women. The lactating women were kind of covered before, a little bit before that. So thank you so much all our panelists for this session. We move on to the next session, which will be hosted and moderated by our mentor, Professor Sanjeev Kumar, public health expert, and also the head of public health, IHW Council. Professor Kumar, over to you. But before that, I would request my team to play an anthem song, which we have especially created for our doctors, nurses, and medical, workforce, in respect of their wonderful work which they have been doing during this pandemic.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
Welcome to the next panel. We have eminent experts who are renowned not only in India, but globally in their field of expertise. We have Dr. Pankaj Chaturvedi, who is director and co-owner of Dermatology and Health Transplant Hospital. He is running as MedLink, and he has had an illustrious medical career. After his graduation, he came to AIIMS, did his MD from AIIMS, and held very important positions. And I will be stealing a lot of time away from the audience if I go into the details. Welcome, Dr. Pankaj Chaturvedi. And we share alumni. I did my MBBS and MD from AIIMS maybe much before you joined. 71 I joined MBBS and later on did my MD from there. Then we have Yash Johri. Yash Jhaveri, pleasure meeting you again. We had met virtually in one of the panels earlier. Dr. Yash Jhaveri is an expert in critical care medicine and emergency medicine. He heads the Regency Super Speciality Hospital chain. He provides critical care medicine and emergency medicine support to all their hospitals, currently based in Lucknow. And he leads across these hospitals a high caliber team of people, doctors, nurses, etc., who provide critical care and emergency medicine. And he has established state-of-the-art critical medicine unit at various hospitals. He again has had an illustrious career, has grabbed all the gold medals which were on offer in his MBBS and PG studies. He has also been trained at Johns Hopkins University, where he did his fellowship. Welcome, Dr. Jhaveri. We will have Dr. Gurpreet Sandhu, who is President of Council of Healthcare and Pharma. We will be talking about vaccines and pharma. So he will be our link to the industry. He also has a very illustrious career. He is now president of a not-for-profit global think tank which advocates for development of sustainable integrated health system and affordable healthcare for all. He has also founded Riva Pharma, and he chairs Care India, which operates healthcare delivery system and chain of pharmacies across the country. He has worked earlier for Tata's, for Daiichi Sankyo. He did his doctorate from University of Cardiff, another institution where I also passed through. I did my MBA from University of Cardiff. If I go into detail, I'll be stealing a lot of time away from the discussion for which the audience is eagerly waiting for. For those of you who are not aware, India is often referred to as powerhouse, superpower, or global hub for vaccine and pharmaceuticals. It's also known as the pharmacy of the world. I often go to United States of America, and most of the generic medicine used in US come from India, has a reputation of high quality, world-class medicine production. Similarly, for vaccines, before COVID struck, 60% of the vaccine given to children anywhere in the world came from India, be it developed countries, be it developing countries. So we have already established our supremacy in the field of vaccine production. Also in vaccine research, we have developed Rota vaccine in India. We had earlier developed hepatitis B vaccine. Both these vaccines, when they came to the market, the international market price of these vaccines plummeted down, because India produced high quality, very effective, low cost vaccine. So India was already known, and even today for COVID vaccine, the most inexpensive vaccines, I won't call it cheap, most inexpensive vaccine come from India. We have one vaccine which was exclusively invented and manufactured in India, Covaxin. We also have a vaccine invented in UK called Covishield, produced in India, and India has become a large hub for production of that vaccine. Sputnik vaccine came from USSR, and the production is going to start in India with 6 producers already lined up. In a few months' time, you will have local India-produced vaccine available. Initially, it is being imported, and there are many other vaccines which are in the pipeline. Some of these vaccines again invented in India and will be produced in India. Other vaccines produced from outside will probably be coming to India, and the production will start from there. So with that brief overview, I will get back to the experts. Maybe first Dr. Pankaj Chaturvedi and then Dr. Yash Jhaveri. Dr. Pankaj Chaturvedi, how do you feel this strength of India has been helped or undermined due to COVID, and how do you see the future of India as a hub for vaccine and pharma production? Over to you, Dr. Pankaj Chaturvedi. You are on mute, Dr. Pankaj Chaturvedi. Please unmute yourself. Yeah, thanks.
Yes. So, as you said, that India is supposed to be the pharmacy of the world. We produce quality drugs, and before the COVID, roughly 60% vaccines were being produced in India. Now, at the same point of time, when there is a pandemic situation, we also need to understand, though India is the biggest producer of the vaccines, but it is also one of the most populous countries. And the internal consumption in a pandemic situation, we don't target the specific groups. We have to give a blanket coverage to the entire population of the country. So this is a marathon task. And what I feel so far, the role of Indian vaccine makers has been commendable. And of course, people may say that the pace has been slow, but if we see the absolute numbers, not the percentage of the population, we have been vaccinating like one small European country almost every day. So, and that too when there were only 2 vaccines. Now we know Sputnik is being, like shortly it will start getting manufactured in the country. And we're also getting Moderna and Pfizer. And hopefully we have the technology and infrastructure to even produce these vaccines. So I see a very bright future when it comes to vaccines and even the monoclonal antibodies. So if you see, the normal monoclonal antibody market is quite big when we treat autoimmune disorders and rheumatology associated conditions. And in a very short span, Indian pharma companies have been able to manufacture these quality drugs. So I'm quite sure as the research will continue and the new drugs will be innovated, India pharma industry will adapt very quickly and will be able to produce quality drugs in sufficient quantities.
Dr. Pankaj Chaturvedi, a related question. We were all waiting for the vaccine. Before the vaccine, I don't know when the vaccine will come. Even common men were saying when the vaccine will come. When the vaccine came, even 100% doctors have not been vaccinated till today. 100% healthcare providers, they were the first ones to be called in on 16th of January vaccine. What do you feel about vaccine hesitancy and what can be done to address that problem?
Sure, very right question. See, we need to understand the difference between the vaccine hesitancy and the vaccine refusal. Vaccine hesitants are those who normally delay the process of getting vaccinated. Like they do not accept easily that, yes, we should get vaccinated. They're basically sitting on a fence. They're not in the mode of refusal. They don't say that I won't get vaccinated, but they're not getting vaccinated promptly. So there are basically three main reasons for this. One is lack of confidence. They have trust issues with the safety. They have trust issues with the efficacy of the vaccine. And at the same point of time, there are two other important reasons. One is complacency. So few of them think that, I may not need a vaccine. Like, I have good immunity, I have a good healthy lifestyle, I do not have risk factors, I'm non-diabetic. So I may not need that much. So this is second category. And third category, those are the people who they are not able to take the vaccine because of lack of comfort. So the vaccine wasn't available near to their home. So these three categories are there. Now, individually, these categories has to be treated as per their root causes. So when it comes to the confidence, so the companies and the government agencies should be very transparent about the safety. So they should be very clear about the side effects. Now, there is a common understanding between the people that the government hasn't disclosed the complete and transparent data about the side effects. A lot of people have side effects, but the government is not disclosing it. So these kind of things are there. And doctors are not exceptions. In fact, I will say when the confidence word comes, doctors are the most suspicious people. But yes, if you compare the number of doctors and the general public, of course, a lot of doctors have taken. Most of the doctors have taken. But we have to promptly address this confidence issue. At the same point of time, this Delta wave has told us that it's not necessary that you have to be in that high risk category. You not necessarily have to be diabetic or overweight or having some underlying issue to get affected by COVID-19. Even the healthy people, and even they had serious issues. So I think now this hesitancy is going down. There should be a proper communication program by the government so that government can gain some more confidence. They should tell that, okay, whatever data we are presenting, that is transparent and is authentic data, be it about efficacy, be it about side effects. And we should also involve different leaders, be it political leaders, spiritual leaders, religious leaders, so that they can target those groups which are influenced by them. So this is how we can actually reduce this vaccine hesitancy.
Thank you. Thank you so much, Dr. Pankaj Chaturvedi, for excellent insight based on your rich experience in this particular area. I will now move to Dr. Yash Jhaveri, and I am told Gurpreet Sandhu is going to join us in a short while. And when he joins, we'll get a more insight into pharma and vaccine industry from him. Dr. Yash Jhaveri, you as an expert and heading critical care and emergency care across various hospitals, and you have worked many such places, and you see the adverse impact, the outcome. People have to be treated in ICU and put on ventilators. Unfortunately, some of them don't survive. So you see that end. So looking at that, and how do you look at preventive intervention, specifically the vaccine, and those who are hesitant, what would you like to tell them in your message today? Over to
Thank you, sir.
Dr. Javed.
Thank you, sir. Thanks for the question. Looking at the magnitude of COVID-19, it was impossible to cater even the critical lot of patients. If we say 5% of them are getting critical, that was also a mind-boggling number for us. And we have seen what havoc was played across the country, and many parts of the world are still facing the same thing. So the best modality was not actually investing in critical care or getting ventilators. The best strategy could be preventive. Preventive, the best tool we had is vaccine. Vaccine is the ultimate savior, not only against serious illness, critical illness and death, but also against the newer strains which are developing. It will certainly add to the herd immunity. There was a very recent data probably published day before yesterday from US. Dr. Fauci only spoke about it, 99.92% Americans who are getting COVID today are non-immunized. So the numbers are self-revealing and self-explanatory. Same happened in the second wave in India. If we see healthcare providers, those who were immunized before the second wave, they had very mild disease, and very few of them had COVID disease actually. Very few had serious or critical illness, and we had seen very few morbidity in those who have been vaccinated. So few of them would have died. But this does not speak anything against the vaccine. Why? Because the efficacy is 80 to 90% at the best. And we know there could be some other physical reasons, some reasons innate to that person where the immunity has not developed. So understandingly and going by the evidence so far, vaccines are probably the best tool in our hand, not only to cater to the massive humanity, but also to cater to healthcare institutions which have been already inundated with a large flux of patients.
Your insight into how our reputation as the vaccine hub and pharmacy of the world has been adversely impacted or favorably impacted by COVID, and how it is going to help us in future to maintain that position.
Thanks for the question. It was again a very cruel irony. India, the largest manufacturing powerhouse, was crippled by a virus where multiple safe and effective vaccines were already developed. So was this a gross miscalculation on our part? I will rather say no, there was no gross miscalculation. We could not just presume what could be the size of the second wave. And we are bound by global laws like COVAX or ACT initiative, where we have to share our resources. We cannot forget, unless every person is protected on earth, we are not protected. So we had our moral obligations because the funding was common and we were already bound by pacts to share these resources. And as a correct individual following the ethical rules, India initiated export to many countries, and we have been a safeguard and a savior for them. Sadly and ironically, the demand suddenly went up for the vaccines. That is why we are seeing this mismatch. There is a demand supply mismatch, which was there, say, after the second wave settled. Still, what I found, if you are very persuasive about getting vaccines, you will get the vaccine. There have been some iniquities. The digital iniquity was there initially, but COVID has again given access for walk-in people to get vaccinated. There are some other iniquities, rural, urban, sex-based iniquities, religion and minority-based iniquities, but these iniquities exist across the globe. Vaccine hesitancy neither is a problem pertinent only to India, nor it has only local causes. The causes are global, and we have to have a multi-pronged approach in a very scientific manner to tackle the menace of vaccine hesitancy.
Thank you so much. And both of you have highlighted prevention, and we often hear from our childhood, prevention is better than cure. I think that statement is a bit mild. It should be prevention is a must.
Absolutely.
Cure is only half-hearted. It may save some it may not be able to save others. People may have lifelong disabilities. So prevention is the answer. And vaccine is, as both of you said rightly, the most cost-effective way of preventing disease known to humanity historically, not just for COVID. Historically. So that point you have emphasized. But let's look at what prevention is. Prevention is you are healthy, you should not get the disease. So how do you do that? Health promotion, you keep your immunity strong. How? Have good food, regular exercise, enough sleep. And there are various traditional and other means of boosting immunity. Scientifically, we still are looking for proof for them. But whatever you do, continue doing that to boost your immunity. But these three factors are known: adequate exercise, proper dietary intake, and sleep. So these three factors contribute to immunity. And if you believe in yoga, meditation, certainly there is a proof that yoga and meditation helps in relaxing your mind. If you do yoga meditation, it contributes to physical activity, and if you do yoga meditation, you get good sleep. So that's how yoga. But don't overdo. Many doctors have come across the kadhas which were being overtaken many times a day, and the patients landed up in hospital because of gastric irritation and related problems. And there have been impact on some of the body tissues, like impact on liver. So don't overdo it. Do only as much as is recommended. But in addition to these preventive measures, which we are still looking for evidence, vaccine is the most important in prevention. Then when you get exposed to infection, early diagnosis and treatment is the second step of prevention. Health promotion, specific protection. Specific protection is from vaccine and related intervention which protect you from the disease, like wearing mask, keeping physical distance, I call it, not social distance. Socially we need to connect, and hand washing. These are the three ways of keeping. Then you have early diagnosis. How does it help? The moment you get first symptom, you are already spreading infection 1 to 2 days before you get first symptom. Immediately isolate yourself. Don't wait for the RT-PCR or other COVID test reports to come positive. Some of these reports may still be negative even if you have symptoms. So isolate yourself with the first symptom. Don't wait for the report. Otherwise, you will keep spreading infection. And isolation needs to be strictly done at home. I have seen housewives, they are so caring, so loving. No, I'm fine. I have some mild symptom, cough, etc. But I can continue with cooking, and she is spreading infection to the rest of the people. You have to strictly follow isolation of those who get infected at home. Then treatment. Get in touch with your doctor so that the disease does not progress to a severe disease. Most of the severity can be prevented if you have early diagnosis and treatment. When your oxygen saturation drops, look for going to a hospital under medical advice. Don't take unnecessary medicine. People exchange prescriptions on WhatsApp groups, and everybody starts taking medicine without doctor's guidance. Medicines like steroids can do harm if they are taken early, because it will help in spreading the infection. It suppresses immunity. When your immune system is hyperactive, that is the time when you need to take steroids. And then disability limitation, caring, breathing exercises during COVID are recommended. Then rehabilitation. We are seeing large proportion of patients, even asymptomatic patients, get post-COVID problem. You need to be rehabilitated with physical exercise, breathing exercises, which will bring you back to normal. So prevention is at all those levels. We have Hitesh Daya, or is it Gurpreet Sandhu?
Well, my apologies, Dr. Sanjeev. He is busy, he is committed.
Okay.
Need to join, and although I'm not as knowledgeable as you people, because I've just spent over a decade in healthcare, but he asked me to join because he wanted somebody to represent the Council for Healthcare and Pharma, and so I can probably share my views on the vaccine.
I will ask you. So thanks, Hitesh Daya, for joining at a short notice. But you are the only one who brings in pharma experience of a decade. मेरा तो एक दिन का अनुभव ही नहीं है pharma industry का. And my two friends who are experts in medicine, have looked at medical side. They are experts renowned, but they are not renowned for pharma. You are the only one who brings that perspective. One question we have asked medical experts also, but you will give us better insight, Hitesh, is on India is known as the manufacturing hub for pharma and also for the vaccine. And I will not repeat the data which we shared earlier, how important India was to the rest of the world before COVID struck. How COVID pandemic has highlighted or reflected the gaps in the Indian reputation of being a power hub, and how do you see it going in future in these two areas, both pharma and also for vaccine manufacture? Over to you, Hitesh.
Sure, sir. Yeah. So, well, I've been, an expert in healthcare, not from the pharma side, but yes, I do have this knowledge, and I'll share it with you gladly. That this is known to everyone. The public, the government.
We have problems, Hitesh. We can't hear you clearly. Hitesh, we can't hear you. I think you have connectivity issue there, Hitesh. Can you disconnect and connect again? Yeah. Can you unmute yourself? Yeah. And let's see if it is better now.
Yeah, sure. So I was telling that it is not new. It is known to everyone that we have not been spending on healthcare what is required. We have just been, spending the minimum on healthcare. However, this COVID has given us opportunity to rethink and to backward integrate, healthcare as well as the pharmaceutical industry, because we might be a hub for API and generic drugs, but the molecules that are required, the raw material that is required for our pharmaceutical industry, it all comes from China. We are dependent on China. Our 60 to 80% of our raw material, which is required for API industry, is from China. As soon as they raise a price by minimum a cent or to $1, it creates a havoc in India. So we would have to invest and backward integrate our healthcare, which includes the infrastructure, R&D, and IP laws has to be stringent, because these are the factors which are stopping international players to come and invest in India. So the medical device industry, you say, our 80% medical devices, our market seems big, the biggest in Asia, third in the world, but we are a consumer market. So most of it, nearly 80 to 85% of the medical devices are imported in India. And most of the people or manufacturers of medical devices just, are catering to the local needs, the syringes, the masks, and these will not be sustainable. As soon as the companies or the countries who are ordering from India, they go self-dependent, these industries would have to close. So we would have to find ways that our doctors, get this knowledge. We do not spend that much in the infrastructure, or we encourage establishment of pharmaceutical parks or medical devices park. So the R&D and the infrastructure can be shared, and the output or capacity is increased. So these are my thoughts, and it is a good time. I'll consider it as an opportunity for India. The healthcare or pharma is in focus. For next 5 to 10 years, we can do wonders with our pharmaceutical and healthcare industry.
Thank you. You raised two very important points, and it impacted not only medicines, it also impacted vaccine. And all of you are aware, there are around 200. There are around 200 ingredients, more than 200 maybe, which are required for vaccine production. Most of them come from outside India, European countries, and they call it Chancellor, the head of the government in Germany, made a statement, in fact, more like accusing India that vaccine production from Germany has moved to India, and they were complaining. And the moment there were cases, both European countries and US banned export of these items to India, and that is the reason India was delayed in increasing its vaccine production. Both the indigenous vaccines were to be doubled in capacity, but that doubling of capacity was delayed by at least 2 months. And it took a person at the highest level to call the counterpart in USA. When Trump lost, he is the one who started this ban. The new president came, he also said we will continue with the ban. It took a phone call at the highest level to talk to the political leaders there, and that ban was removed. And now you have raw material for vaccine coming to India. And the raw material for pharmaceutical industry is often referred to as active pharmaceutical ingredient, API. Most of it, 70 to 80% comes from China in India. And this has been a shock and an eye-opener for us. If we continue to depend both these vaccine and pharma, we will have any problem from any one of these countries in supplies. We will get into serious problem. Yes,
Professor Sanjeev, so now there are two important things that we should understand, that the quality of medication for most of the manufacturers in India in pharmaceutical, everyone knows this, but nobody says it out loud, that the ingredients which are made, or the medicines or the drugs which are made for Europe or US, they have a different level of quality. However, the drugs which are made for domestic consumption are of different quality. And many of the manufacturers, due to lack of information and knowledge, are afraid that, US FDA would put us, a warning letter, would send us a warning letter, it would impact our shares. They do not want to get their hands, into European market or US market. They settle for less profit, but they think that, will not be able to manage the quality levels which the US FDA asks. And that is a total myth. If people are informed, if the government, is not, the industry and government should work together. There should be a platform where all are not working in silos. And this vaccine diplomacy also has exposed us. Had government and industry moved like they are doing in USA, we would have been able to sort it out much, much earlier, probably 6 to 8 months earlier. The things which are being exposed now, it is like now there is some fire and we are, throwing buckets, to extinguish that fire. We should have been prepared much before, probably a year before. So, but these are all scopes of improvement, and we should, if we work cohesively, we would be much, much better prepared for the next time.
Can I add, sir? Going on the same big question which has been boggling our minds, probably the world manufacturers realize this, that the API they were getting from China, their industries, especially if we talk about Europe, major pharma industries and biomedical equipment industries have moved out of Europe, and they were importing large chunk of equipment and drugs from India and China. So we all were going wrong, and this was against the principle of self-reliance for any country. This pandemic made the world realize that they have to be self-sustained on all these fronts. Now, India suffered a lot. The image also suffered, rightly. But still, India is seen as a powerhouse. African countries, low middle income countries, and even Southeast Asian countries are looking towards India. We have seen the efficacy of Chinese vaccines is dismal. And many countries like Seychelles, UAE, Saudi, Iran, they are looking at their program in the renewed knowledge. So yes, we suffered on our image, but probably this was a lesson not only for Indian manufacturers, but the countries worldwide. And now majority of pharma industries are trying to get all their APIs from Europe. It is costing a little more, but that has been the general trend now, and they are trying to get all their APIs from Europe.
Yeah. Dr. Pankaj, you have any comment or suggestion on this nationalism and importing products from outside? Over to you, Dr. Pankaj Chaturvedi.
What I feel that today, in the era of globalization, it is very difficult for a country to gain expertise in everything. Right now, we know that when it comes to Indian industry, pharma industry, the APIs were coming from China. That is true. But if we start doing our own production of APIs, it will take time because these industries, they can't be set overnight. The similar problem is being faced by the electronic industry, the computer industry, because chip manufacturing happens in China and in Taiwan. And a couple of issues are there. And because of that, the waiting period has shot up to 6 to 8 months if you want to get some a customized computer or any medical device. But yes, we should be careful that when we are completely relying on a hostile partner or a hostile country, then we have to keep a backup as well. Yeah. And that was the reason, like now we are taking the raw material from the Europe, and the China has been hostile to the entire world. Like even the European industries, they were more relying on China for the product because of the cost issues. So why a country, even if it's a European country, why it will buy an expensive API from America or the neighboring European countries and rather import it from China because it's much more cheaper. So it's difficult to develop everything in the country. It's very difficult. We have to make an ecosystem which is based on trust. And of course, yes, we should not rely completely on a hostile country when it comes to the core industries. So be it electronics, be it pharmaceutical, we have to make our new partners. At the same point of time, we should also develop the API manufacturing to a certain extent in our country so that if there is a major geopolitical change, we are not completely into blank. We're not into in a completely helpless situation. So some amount of production should be there in the country.
Right. So we have always had this debate, nationalism and globalism, and globalization has been happening at a very rapid pace. But we have to weigh where the interest of the country lies. I agree with all three of you that we cannot produce everything, but at least for the essential requirements like medicines and vaccine, we need to be ready in case there is a crisis. There is a shortage across the world. And the vaccine nationalism is known, like vaccine diplomacy. There is also vaccine nationalism. What these countries which were rich did, for example, Canada has bought vaccine which is sufficient to vaccinate with both the doses 5 times their population. US, Australia, all these countries, European countries included, ordered, not just ordered, purchased the vaccine. So Pfizer and Moderna, etc., they had no vaccine left to export. Only after US said, yes, now you can go and export, they started exporting. And the vaccine which they had stocked up, they are now donating that vaccine. So that distortion comes in when you have nationalism taking over, supplies being, and in India, we are, an ancient culture. they are talking about no one is safe till everyone is safe. We were always talking about ayam nija parovetti ganana lagu chetasam udar charitanam su vasudhaiv kutumbakam. You know, vasudhaiv kutumbakam, the word comes from this ancient Sanskrit verse which I studied in my Sanskrit classes in school, and I still remember them. So it will remain one word. Earlier, when the pandemic started in the last century, it used to take 1 year for anybody to go around the world. Now you can go around the world and spread the disease in 1 day. So globalization, whether we like it or not, is going to take place, but we have to secure our country and our people in the country, their interest in crisis situation when the countries start putting curbs. Not just China. European countries and US did it much worse than China when it comes to putting ban on vaccine, etc. And today we all have questions, you know, whether it was deliberate from China or accidental from China. The bomb exploded in China and the splinter went to the rest of the world and exploded with much bigger force in these countries. Who will hold China accountable? Even if they did not do it deliberately, why did they not contain the outbreak in the initial stages? By the time they put constraints on international travel, 550,000 people had already traveled from Wuhan to United States of America. They were already in severe crisis. They didn't have testing kits. India was relatively better when the crisis happened here, but they had no testing kits. People were tested months after they had given their blood samples. So it happened. But who will hold the first country where the outbreak started? International community has to find an answer to that. Yes, globalization is good, but national accountability, somebody should be there to hold them accountable. As of today, we don't have international mechanism to hold countries accountable. If we don't do that, this is the 5th pandemic or epidemic which started from China to the rest of the world. There were 16 other pandemics in the human history, starting with 500 BC. But in today's globalized world, they spread much faster. We have to look at country accountability and take care of this nationalism which comes in, and the rest of the world suffers from that. Dr. Hitesh Dahiya, can you give us insight more into how the future is going to look with this? You are referring to backward integration. In management we call it vertical integration. How this is going to work in India specifically, and how India is going to emerge out of this shock we all had. Shortage of medicine, oxygen, vaccine, we couldn't give it at the pace we wanted to give. So how does the future look to us?
Well, sir, I see that, you know, there is so much of light at the end of the tunnel, so much, because this is the first time healthcare and pharmaceutical industry has been in talks apart from all other sectors of India, and people have understood that healthcare is of esteem and the utmost importance. And now, you know, that it is getting importance, what is required is to work cohesively, because China also did not do it in a span of a year or two. They were continuously doing for the last 2 or 3 decades, and then their government pushed in. They channelized, and they put the price caps, and they also included quality parameters to the level of US FDA, and it was not done in a day. And we cannot deny the existence of China, how powerful they are in world economy. And I do give them a lot of credit for showing the world what a country can do. But it is not stopping India in any way to become on the similar level, because we are also a diverse country. We know, people say that, you know, there are 2 popular things in India. One is jugaad, which is accepted in a positive way these days, And the definition has also been changed, and we have forced the definition of the word to be changed to resourcefulness rather than being a jugaad and negative way. And the second is Bhagwan Bharose, because we, when do things in a positive way with a noble intent, we will succeed. So the future will hold India, and is still, no matter the image has been, slightly distorted, but yes, people still are looking up to China. The poor nations are looking up to, India, and we are at the prime focus. Yes, we have the capabilities, we have the skill, we have everything in place, but what we need to do is work cohesively. The government should understand that the businessmen or the industry are not solely working for profit. They also want to do good. And the government should also be inclusive in decision making. People from healthcare, medical device industry, pharma industry, and the businesses also should look at their social responsibilities and just also not run away, run for the profit. If we work cohesively, India in next 10 years, I believe, it can be slow or it can be rapid, but in next 5 to 10 years, India will hold a key position in the healthcare industry. I'm certain of it.
Thank you. That sounds very, very positive. The message you have given, let's not go into criticizing ourselves, the system, or even other countries. Let's learn from this experience and build on this experience. Jugaad is a term which is, not taken as positive.
Professor Sanjeev, I'll just take 1 minute.
Sure.
Most of you in the second wave would have had WhatsApp groups, and COVID was a situation which emerged. So the good people became, the representation of a true God. But people, who were indulgent to hoarding and etc., there were example of those also. But in your WhatsApp groups, a family group, a school group, a college alumni group, you must have seen people going out of the way, helping people, without asking their names, their position, or the amount of money they had. So this is beauty of India. This is Indian beauty. No matter how diverse we are, when the time comes, if we are united, we can achieve.
Very, very good. Thank you. And you talked about jugaad. I will prefer a Western term, which is not derogatory, which is appreciated: innovation. We are innovative people. You walk into any kitchen in India, you will find at least 1 or 2 innovations. Even in a kitchen, the housewife may be illiterate, but she knows it well. So we in India are good at innovation. Let's put it in a systematic manner. And the urge, every one of us has to do good to the others. That was highlighted. Thanks, Hitesh, for raising that point. I'll come to Yash Jhaveri and then to Dr. Pankaj Chaturvedi. Your last words on this before we close the discussion.
If we talk about vaccine production, we have to think global, act local, and be vocal. As Mr. Dahiya also pointed out, we have to look at innovations. And as you told, we are talking about Vasudhaiv Kutumbakam. So I don't see anything wrong with the Vaccine Maitri program. And if we are a larger manufacturing hub, we are responsible for the larger good of the people around us, for the countries around us. Then only the cost of API and the manufacturing can go down considerably. I always want to remember this mnemonic, 6 A's of vaccine. First is acceptable. We have to make vaccines acceptable. We have to convince people. We have to make some confidence building measures while we talk to public. What we are busy doing, we are just using this word vaccine hesitancy. We are not looking at the root cause. There could be some genuine causes. There could be some myths which are doing the rounds. Pseudoscience has to be differentiated from science. Availability of vaccine, affordability of vaccine, accessibility, especially if we talk about far-flung areas, the vaccine has to be made accessible. Administrability, now we are talking about injection less, syringe less, injectors. We are talking about nasal vaccines, probably that will be game-changing. And accountability. And COVAX Act and other global initiatives we are accountable for our acts, whatever we do. And vaccine is the largest tool to prevent this mayhem from COVID. Thank you, sir.
Thank you so much, Dr. Yash. Very well summarized. Over to you, Dr. Pankaj Chaturvedi, for your last words.
I think currently one of the biggest challenges we have is the vaccine hesitancy. I remember my days when I was doing my MBBS, and in my social and preventive medicine, I was given the task of accompanying the team of Pulse Polio program. And so we used to carry the vaccine in the areas where there was a lot of hesitancy. And there were groups who were literally willing to beat us, and they were not ready to take the vaccine, despite a lot of data, a lot of scientific literature. We showed them that it is safe. In fact, a few of us, we demonstrated that, look at this drop, and I just had it. It's safe. So I think the involvement of local leaders, the spiritual and religious leaders, is very, very important, because they have a very good grip on these groups. So rather than just running the campaigns centrally, they should be more localized. We should take the loop, local, small Gram Pradhan, Sarpanch, Pujaris, Maulvis, a few, influential people. On the social media also, we should take the help of the influencers, because they also, they have a lot of followers. So vaccine hesitancy is one of the major hurdle. And yes, pharma industry is gearing up. I'm quite positive that in the next 3 to 4 months, the lack of vaccine, the issue which we are facing, that will be addressed, because newer vaccines are coming. Plus, we are again in the mode of manufacturing. The raw material issues have been sorted out. So I'm quite positive that in 3 to 4 months time, we'll be in a much confident position to tackle and to gear up ourselves for the third wave.
Thank you. Hitesh, last messages before I conclude?
Yes, sir. I totally agree with Dr. Deepak. He has shared the on-ground reality with us, and the WHO has also agreed that vaccine hesitancy is not new. It has been there since the last decade, and it has been amongst the 10 threats to the global health. WHO has agreed. It is not just about the COVID. People were hesitant earlier enough also, prior to COVID. So for that, as he rightly mentioned, we will have to include, the social figures, the local leaders, religious groups, and the vaccine centers, for that matter, could also be opened into a gurdwara or probably a temple, and the most important is informing people, clearing their doubts. The younger generation also is, doing a wait and watch thing. They're saying, okay, I'll wait, you go have it, and then, probably I'll see, and then I'll, take a decision later on. So, yeah, we should inform masses on this.
Thank you. Thank you so much. So I'll summarize now. I have, put it under 5 headings. I will start with the good news. All of you have said future for India as the vaccine hub and as the pharma hub is bright. We have learned lessons, and those lessons, government is looking at it, but it should happen sooner than later. And as Hitesh said, the policy and the legal environment also should become supportive for industry from outside to come in India and set up things for raw material, acute pharmaceutical ingredients, and the raw material for the vaccine. So that is the good news. And then, if I remember correctly, it was Yash Jhaveri who said, think global, act local, and be vocal. So that is the second message. Third message which I heard from Hitesh is, let's look at innovations. Not call it jugaad. When you call it jugaad, it becomes something, done in the backyard and not done properly. Innovation, even that is a respected innovation. People who are semi-literate or even illiterate show us the way forward. The fourth message is related to what I think, Yash Javeri again said, and in US, if 500 people got COVID, only 4 got COVID after vaccination. Who had not been, only 4 got who had been vaccinated. 496, which is 99.2%, got it who had not been vaccinated. So vaccine is a very effective way. We have been waiting for vaccine. Please go and get yourself vaccinated as soon as possible. But vaccine is not 100% effective. So you have to continue following other preventive measures. Wearing mask, washing hands, keeping social distancing, and second wave has shown us that many of our family members who never went out of the house, they got infected. There are only 2 ways you can get infected. Either you go out of the house and bring infection, or somebody with infection comes to your house. So be careful if you invite a visitor, and maintain social distance. Insist that that person wears mask. The moment people enter your home, everybody takes down the mask, including the visitor who was wearing a mask till he or she came to your door. So make sure that you follow other measures. So the fifth message is, yes, nationalism and globalization will continue to conflict in a situation which is life-threatening. But let's look at what have we learned from it, so that we can make our country more self-sufficient. So with that, thank you so much. It was a pleasure listening to Dr. Pankaj Chaturvedi, Hitesh Daya, and Dr. Yash Javeri. Your insight has really enriched the discussion and given us a new perspective how we can take advantage of the strength we have in India, and how we can further strengthen India being vaccine hub and pharma hub for the rest of the world. Thank you so much. Anisha ji, you take over for the next session. Over to you. Thank you. It has been a pleasure.
Thank you so much,
Thank you.
Professor Sanjeev. Thank you so much, Mr. Javeri. Thank you so much, Dr. Deepak. Very, very enlightening. Thank you so much.
Thank you, all of you.
A big thank you to all of you for joining us, and Professor Sanjeev Kumar for taking us through this session. During this entire gratitude week, we've learned so much, and every day we continue to learn even more. Thank you all for joining us. It is a pleasure to have you with us to share your perspectives. Let's now move on to another session, and I would like to welcome everyone to this session of the Gratitude Week from the 1st to 7th July. Now, we celebrated National Doctors' Day, which was on the 1st of July, and we decided to extend this Thanksgiving marathon for about 7 days to thank our healthcare heroes for their untiring efforts and service to the nation during the hard times of a pandemic. And we will carry this gratitude in our hearts forever. Now, we have heard a lot of heartwarming stories from doctors, from Good Samaritans, tending to COVID patients during the pandemic, where doctors have come out of retirement to teleconsult with patients. They've been working multiple shifts in stressful ICU environments, not seeing their families for days at an end, consulting even when they themselves have contracted the virus, and so on. Doctors have had to work in very stressful situations where oxygen was running short for patients, and managing severe COVID patients was very difficult, especially in some cities like Delhi in the recent second wave. Now, in this session, we are going to talk about the nightmare of the COVID second wave, overwhelming hospitals to oxygen shortage, how doctors and COVID Samaritans work hard to save lives. Now, please welcome our speakers who will be talking about what happened, what they did, and discuss this topic with us. Please welcome Dr. S.C.L. Gupta, the Medical Director, Batra Hospital. Please also welcome Dr. C.M. Bhagat, the Director, Bhagat Hospital. We're hoping that we'll be joined shortly by Mr. Abhishek Singh, IAS Deputy Commissioner, Delhi. And we're very happy to have our guest with us to talk about the situation that arose in the last part of April and the first week of May. Now, let me start with you, Dr. Gupta. Can you describe to us what were the scenes like? What was the situation like in the last week of April for your hospital, Batra Hospital, which is in South Delhi? You had COVID patients coming in. There were many, and there was a shortage of oxygen. Can you describe the situation to us?
Good afternoon, Anisha. Thank you very much for organizing. This was very difficult to explain the situation, how we have gone through those days. आजकल तो सोचने से भी डर लगता है. We have gone through that state. Second wave has taught us a lot of things. How much we are prepared to deal such pandemics. What happened initially in the first stage? There was a complete lockdown. Hardly anything was coming out. People, they were not coming out. And the first wave gone easily without damaging much, except of course the economy. But in the second stage, since first stage has gone very smoothly, so in fact nobody was bothered about the second wave. The second wave will come with such a intensity. Markets was open. Hardly anybody was following the social distancing or personal distancing. Hardly anybody was using the mask. Markets was overcrowded. All the functions were going on. And suddenly, the cases started increasing. Though the problem was all over India, but in Delhi this was specific in the sense, because Delhi was hardly producing any oxygen. This time, the second wave, second pandemic, the Delta variant, this was actually targeting the lung tissue. And everybody was coming with the respiratory distress. Unfortunately or fortunately, both the things, the social media and media was very active. So a lot of information and misinformation both was going outside. People, there was panics. Anybody who was getting fever, anybody who was getting cough, he will be contacting the local persons. And there was a parsa moving, a prescription, old prescription was moving everywhere. One person prescribed to some particular patient having A, B, C, and that was moving everywhere. The patient is symptomless or symptoms, very high symptoms, whatever it is. But people were taking drugs. Suddenly, at the peak of a second pandemic, there was a lot of respiratory distress people. And we have faced, there was hardly any bed, there was hardly any medicines, and there was hardly oxygen available, which was the main plank of the treatment. Delhi was not producing any oxygen. The government was very careless. There was hardly arranged any beds. Whatever the available beds was there in the private sector or the government sector, changed into a COVID hospital. COVID hospital is a very, very difficult to arrange a separate COVID beds, because a lot of people, the doctors, the nurses and the healthcare workers, they are scared of. Everybody has to be in PPE kits, and is a very, very highly spreading disease. Hospitals, they are not being constructed as per the COVID, so that was the problem.
Right. So
hardly drugs available, hardly oxygen available. Patient was coming in as a crowd to the hospital emergency. Everybody wants to get admitted, and no beds. Suppose beds was available also, so there was no facility for the oxygen. Delhi was not manufacturing any oxygen. Surrounding area from where we were procuring the oxygen, there was a pandemic there also in Uttar Pradesh, in Rajasthan, in Uttarakhand, Haryana, everywhere. So they stopped giving oxygen to the Delhi, and the role of Delhi came because Delhi has took over. Delhi government has taken over the supply of oxygen with them, and they could not supply oxygen. That was the problem, and lot of people they died. Lot of people they mismanaged because of particular this.
Right. Let me also ask Dr. Bhagat to describe the situation at his hospital. Now, the number of people who contracted COVID was huge because it was very infectious. Now, did patients come to you only too late? They were breathless. Did they come to you early? How did it become so bad that we were completely swamped and hospitals ran out of oxygen?
Good afternoon, Anisha and Dr. S.C.L. Gupta, my senior. You getting my voice?
Yes, we can hear you. Please
Okay,
go ahead.
okay. Yes, Dr. Gupta summarized many things. The sudden onslaught, as you can say, it was an attack by a foreign, and the system was not prepared for it. And the system got into disarray. Patients were coming late because, one, they wanted to avoid going to hospital. And there were so many online prescriptions available. They kept on trying, and they kept on monitoring their oxygen. In the first wave itself, when post-wave analysis was done, it was pointed out that domiciliary care was overextended and patients were coming late, and that is why in the later part of that, there were a number of deaths which are there. Here also the same thing happened. The patients were staying at their home for a longer period, and once they wanted a bed, they were not getting the beds. They kept on searching everywhere, and there were calls and so many things were there. So there was no semblance of any administration or control, or the Pandemic Act was there. But if you give me permission, I will sue this government for not handling the situation properly, because they had no administrative capability. They were just issuing circulars. Ask Delhi government how many circulars they issued. They run into more than 1,000. Morning, evening circulars, Dr. S.L. Gupta must have received every day. Morning, evening, he's nodding his head. And that means they were not understanding what they were doing. That is why they keep on ordering. And this is what happens in a situation when you don't know what you are to do and you are the boss. So you keep on giving orders right and left to show that you are doing something, but actually you are disturbing the situation. Patients were coming. There were no beds, definitely. We were all asked to extend the number of beds. Now, you see, there are certain norms, and our association has been talking all the time that the number of beds in Delhi or in our country is below the WHO standards, much below the WHO standards. Rather, we were running almost to 60% of that standard. So now the number of beds had to be increased. So we were ordered to increase the number of beds by at least 15 to 25%. Increase the number of oxygen beds. Now, oxygen has a supply system. What was the supply system? There were two, I would say, if you divide it, one was liquid oxygen supply, which is generally used by the bigger hospitals and corporate hospitals. Dr. Gupta's hospital also is using liquid medical oxygen. I am aware of that. The second is a cylinder supplied by the vendor, and they were being given to the hospitals of my size and smaller than my hospital. One is 85 bed and the other is 40 bed hospital facility. So we were being supplied by these cylinder vendors, and there was a regular supply for last, you can say, almost 2 decades. Now suddenly this whole system of oxygen was disrupted. Government took over, but when they took over, they did not do any homework. Once you are disturbing existing pipeline supply, you always create a bypass channel so that the existing system continues and you give support to the system. Here what happened, they took over the system, but they did not give support to the system. So the result was whosoever made a lot of noise, they were provided with liquid oxygen, and the vendors who were giving oxygen cylinders to the patient, to the hospitals, they could not supply oxygen to the hospitals which they were providing. And yes, the amount of oxygen was almost 5 times what I was using before. If I was using 30 to 40 cylinders per day, during the peak of COVID, I was using almost 180 to 200 cylinders. So this sudden jump in, of course, it is bound to create a disturbance, which was going to have its impact, because oxygen being a critical component, and as Dr. Gupta rightly said, we never faced a situation when there was a shortage of oxygen in Delhi. But that means if I make a statement from management viewpoint, or from anybody who is handling critical situations, when you are having a critical situation, don't you create a plan 2? The plan 2 was never there. The plan 2 was not on the paper set even. There was only plan 1. Of course, now the plan 2 has been put in place, and there is enough storage capacity in Delhi. So this plan 2 was very much required, and it was not there. And even if it was not there, somebody should have done the homework, somebody who had good administrative capabilities. They should have been brought into the picture immediately, and they should have handled. Let me tell you, at this age, my age is around 66, I went to the oxygen vendor all over Delhi, taking my own trucks, carrying 50 cylinders, standing in the queue, standing on the platform, begging the officers, stupid officers standing there, please give me oxygen. They said, you have taken in the morning. I said, if I have 110 patients in my hospital, 50 cylinders which you gave me in the morning is not sufficient to carry the whole day, not even 8 hours. They just refused to give. So patients were bound to die. Fortunately, I myself, in my own wisdom, 5 years back, had installed a oxygen generation plant. And that gave me support. Otherwise, patients would have died in my hospital also. Fortunately, none died because of shortage of oxygen. Yes, there were a number of deaths. Almost every day, we would send the bodies from our hospital to the cremation ground. But it was my wisdom that plan 2 I had put in place in my hospital, but most of the hospitals did not have plan 2 in place, especially the small and medium hospitals. So this absence
Dr.
of plan
Bhagat,
2...
One question that I have then is, if you had an oxygen plant, why were you running around for oxygen cylinders?
You see, every plant has a capacity. This plant which I was having, that had a capacity of about 25 to 30 cylinders per day. If my requirement had gone up to 180 to 200 cylinders, I had to get it from outside. My vendor who was supplying me, you see, I had both the things in place. I was generating my own oxygen, and I had a reliable vendor who was supplying me almost 20 to 25 cylinders per day, and I was using that. Now, this vendor was also changed. The vendor which was close to my place was changed from, I am in Janakpuri, my vendor in Dwarka. My vendor was in Mayapuri, which is just 5 kilometers from my place. My vendor was changed by an official order, and nobody would listen to it. My vendor was shifted to Nangloi. That you go to Nangloi, and this was much later. Before that, it was you find out where is oxygen, you keep on sniffing like a dog, where is oxygen available, and you rush there to get some cylinders. You are lucky if you get, otherwise you go to another vendor. So incidentally, most of these vendors were in Nangloi and Mundka area, and beyond that, so it was not easy for rest of the Delhi to rush there and get oxygen cylinders.
Right. So I want to check with you, Dr. Gupta. Dr. Bhagat is saying that there were orders that were being given to you, and you just kept getting a lot of orders from the government with directives. Were your vendors also changed? I'll come to you also, Dr. Bhagat, but Dr. Gupta, why do you think all these changes were happening? I mean, you have a well-oiled system which was running. It was under pressure. Why was it completely being overhauled?
See, there are two things, ma'am. Anisha, one thing is that you are passing order and order and order, and second thing, you are really doing a management. So here there wasn't hardly any management. In the sense, suppose you need 5,000 beds or 10,000 beds in Delhi for any crisis. Then you have to create amount of beds, not you transfer the amount those beds to COVID beds. Now what was happening here? In LNJP hospital or any major hospital, Apollo hospital, Gangaram hospital or Batra hospital, these hospitals, they are catering the healthcare facilities to almost every part of Delhi and surrounding areas. And they are 80% full. Suddenly what you have taken the rights of those 80% persons and changed the hospital to a COVID hospital by one order, without any much facilities. Now, the moment you are changed COVID hospital, but where will the cancer patient will go? Where the heart patient will go? And you have changed all ICUs. Number one. Number two, the moment you have taken over the oxygen with you, and you have changed, as Dr. Bhagat is saying, you have changed the vendor. That's happening everywhere. Like we were getting oxygen from 2 vendors, running this hospital for the last 35 years. Never had any problem of the oxygen. Why suddenly we had a problem? Because they have changed the vendors and they have taken over and asked, hey, you give it to. And he's lucky because he was getting them at least talking to. We were not able to get their telephone numbers. We are begging it's like a beggars who are asking for these people to give me the oxygen for the patients and running a 500-bedded hospital. Second, once they have taken over, they didn't have anything infrastructure. They didn't have a truck to supply. Delhi, administration-wise, Delhi has got 11 districts. What I have suggested them, at least you should have 11 trucks with you. 1 truck of liquid medical oxygen per district. Because see, whenever there is a SOS call, whenever there is an emergency means you need in 10 minutes, 15 minutes, half an hour, 1 hour. And if you are getting an oxygen supply after 3 hours, 4 hours, 5 hours, 6 hours, then this is not an SOS call. When I had a problem in my hospital, morning 6 a.m. I was trying to contact people. Till 11:30, nobody has bothered. 11:30, we knew that the truck is there in Mundka area and far off area of Burari and Kirari areas. And it will take at least 2 hours to reach here. We have a supply also in our manifold system, but that can supply to 2-3 hours only with the big cylinders. And there was a moment when there was hardly any oxygen here. You are running a Delhi state and there is no drug available. There are hardly any planning as the government side is concerned. You are opening a new makeshift hospital. And the hospitals in Bhagat Hospital and Batra Hospital, any hospitals, bigger hospitals, beds are lying vacant because there is no oxygen. Where to admit the patient? You will not admit the patient just to make a death certificate. You are providing those makeshift hospital. What facilities are there in makeshift hospital when एक बिस्तरा है, एक नर्स है, एक बगल में टेबल पड़ा हुआ है और कुछ नहीं, एक्सरे नहीं हो सकता, जांच नहीं हो सकती. In makeshift hospital, you are providing oxygen, or you are not providing oxygen to established hospital where you can save lives. On 1st of May, we have lost 12 patients, and one of the very senior doctor of this hospital, a senior gastroenterologist, we lost because of lack of oxygen. Do you think he justifies? Rightly, he said, if he gets the permission, he will sue the Delhi government.
Yes, I think management at a time like this could have been better because just before the cases started coming up,
this was the situation in the ward. Think of the emergency. We have a 10-bedded emergency, managing 50 patients. Anybody who is coming to the emergency is not going back. He said, kill me here, give me oxygen. I will prefer to die here than I will be going back to my house. There are hardly any bed available. And we have to supply oxygen to those 50 patients, also those who are lying in the emergency and they need intensive care. And we don't have a beds. Just because we don't have an oxygen here. We don't have a drug available. Remdesivir, mare ghum raha aadmi.
Yes, it really does sound very heartbreaking for patients who came to your hospital seeking care, and for you. Your helplessness is really heartbreaking. Dr. Bhagat, in the beginning, we were told, no, we are prepared, we have enough beds, we are not going to have a problem. Where is the mismatch? You see patients every day, right? Did you anticipate the number of people who will get COVID, who will deteriorate so fast and come to the hospital?
Nobody
have estimated it.
Nobody had estimated that. Frankly, nobody had estimated. And everybody was going from the experience of the first wave. Everybody, including administration and myself, we were ready. Though we had the day we started getting more cases, we started expanding our infrastructure. But yes, nobody had anticipated this much onslaught. So many deaths we never anticipated. And the only good thing was, in the first wave, the staff was not very cooperative. In the second wave, they were vaccinated. Some of them had learned, and some of them had already been infected, the staff. So they were more cooperative. We had better staff this time. But you see, the bed patient and staff ratio had gone haywire. Definitely. It had gone haywire in almost all the hospitals. But we were managing it, except what Dr. Gupta said. Even I had to put up a notice for 2 days. Sorry, we are not admitting any case because there is no oxygen. We were maintaining the patients which we already had with us, because the supply was only those 25 cylinders which I was generating. And so we had to say no. Patient said, Doctor, bed khali hai, aap dete kyun nahi hai? They could see, but I refused. I said, sorry, those patients were already admitted with me. I have a liability towards them. I cannot take more patients. Find somewhere else. So they opened centers. There was a lot of, but you see, all this is past. We have learned a lot from that. And I would prefer to discuss something which we can do in future and move forward. And for that, I will quote, again, I have mentioned many times, the Mumbai model, which our Prime Minister also mentioned. Mumbai Commissioner, Mr. Chahal, he had used a model where he had isolated the patients in the massive COVID care centers, and only critical patients were admitted in the bigger hospitals, regular hospitals. And every patient report was coordinated center in Dr. Gupta's hospital has done a test. The test report could not be given to the patient OPD directly. It had to go to the center of the patient and see that where this patient goes, depending upon his location and condition. That was a central control. This is what is command. This is called COVID command. COVID command is not a room where you put a plate and post some pictures and selfies from there and then say that we have created a command. So here, the command was managed by the doctors. They were watching the condition of the patient, and patients were being directed. And you tell me, did you listen any such noises what you were getting from Delhi, from Mumbai area?
No.
We did not.
They also had lots of patients. They had
more patients than us. They had more sick patients than us. They had a longer wave, but they managed it very well. They arranged for the staff also. Here what is happening is, the system is administered by the judiciary and the administrating officers who don't know what is the system requirement. They keep on fighting amongst themselves. The moment court makes a remark, they issue an order. I'll give you 2 examples. One is, every hospital should have its own oxygen generation system. And this reminder has been sent to almost all and a show cause notice has been issued by the Delhi government to almost all the hospitals, whatever their size was, that you create your own oxygen. This was done after the court observation. This was about, now today is about 20 days back, 25 days back. And that means after the wave was over, to be ready for the third wave. So instead of doing something themselves, they started putting the burden on the hospitals which were providing services. Now, you see what happened. All these suppliers of these oxygen concentrators and oxygen generators, they jacked up their prices. And since I am experienced with last 6 years with the oxygen generation system, I know what the problems are. So I immediately raised the objection. I said, please don't ask the hospital. One, it is expensive. Oxygen, which was coming at almost very low cost, will become very, very expensive. 2, there is a breakdown because these are high speed plants and the machines are running round the clock. So there is a breakdown and you have to provide for breakdown also. And thirdly, the quality of oxygen generated by these oxygen generators and concentrators is 93 plus minus 3% in quality, I would say simple terms. And the oxygen supplied by liquid medical oxygen and in the cylinders by the vendor is almost 99.9% pure. So there is a difference in the quality also. And the purity checks are not there in what you are generating at your own place. And it consumes a lot of electricity. Today, fortunately, if we have enough electricity, we can run these plants. All these plants are based on electricity. And they create a lot of noise also. There is a persistent humming noise, which is irritating also. and breakdown is there. Then there are the replacement spare parts. You see, with thousands of such machines being imported in India and being put to use, where are the spare parts? Who will ensure that somebody keeps on providing? So many vendors have come overnight. I know. I'm in this system for the last 37 years. I was suddenly surprised to see such a gush of vendors who are there. That means they were waiting for these administrative orders. If I point out that there is a corruption in this thing, I may not be wrong. That somebody has been benefited by the sale of these oxygen concentrators. This is one aspect. The second is we should not dismantle the mass camps which we have installed in Delhi, and they should rather increase or be ready with the more such isolation areas so that the infection does not spread in the community.
So patients, you're saying COVID centers. These are COVID centers.
Yes. You see, Bombay had many such centers. I think 7, each one having a capacity of 5 to 10,000 or 20,000, some of them. So they isolated all these patients. That is also required in Delhi. And the request is nobody should make noise. Rather, they should work on these areas, identify areas where they can be installed. And all the reports should be monitored where the patient. Why should the patient who is sick and his attendants who are also sick run all over Delhi to get the hospital bed?
That is the thing. That we were getting so many SOS messages.
You keep on yes. And I receive a notice from Delhi administration morning after evening with a threat that action will be taken against you under Pandemic Act. You see, why can't I take action under the Pandemic Act on these officers who failed to deliver?
Yes, there should be.
So it was very, very disturbing, very disturbing. Very, very disturbing, and somebody should take them to task. But now I feel, whatever the reports I have got, Delhi has about 390 metric ton of liquid oxygen storage, which they have generated or in the process of setting up. And they have bought 6,000 cylinders, which they have placed at various places. Because the sudden demand in oxygen cylinders created another problem. Vendors, the unscrupulous people, they started painting the fire extinguishing cylinders, changed the valves, and painted them black, and they were sending these for filling. Now, this is a major problem. Suppose the vendor fills this cylinder full oxygen pressure, these cylinders would have blasted. So what happened? These vendors, they reduce the pressure, knowing that if they say no to the patient or who has come for cylinder refilling, there is going to be argument and there is a fine which will lead to stalling of the work. So what they did was they reduced the pressure to almost 30-40% of cylinder filling pressure. I know this thing because I was standing at the platform. These work areas. I'm sure no hospital administrator had gone there, but I was there. I'll show you a picture of mine, standing and almost crying that please take care of it. So these pressure, this was another problem, that wrong cylinders were being used for oxygen filling, which now they will all go waste. Then number of untested cylinders also came into the system. Industrial oxygen has been blamed, but I don't blame it because I feel the specifications of industrial oxygen is better than IP, which is pharmaceutical standards. So industrial oxygen cylinder is not a major issue. But yes, testing of the cylinders and follow-up of the cylinders is an issue which somebody should tackle. And we will face this problem because all the cylinders which people have bought, once they go for refilling and the authorized centers, they are sooner or later going to say no. Sorry, we cannot fill these cylinders. So a lot of black marketing has gone. A lot of people have made money. But now system should be put into place. These things should stop.
Yes. Now I think there isn't this massive demand, so perhaps all this black marketing should not happen. Dr. Gupta, have you also set up an oxygen plant? What are your views on being self-sufficient when it comes to oxygen, or at least largely self-sufficient?
I agree with Dr. Bhagat and disagree also with Dr. Bhagat. See, a certain amount of oxygen should be available within yourself. Batra Hospital or any other major hospital with a 500-bedded capacity regularly requires about 1,500 to 2,000 liters of liquid medical oxygen per day. And producing a 1,000 liters plant, as Dr. Bhagat said, lot of humming sounds, lot of electricity, and the basic thing in nutshell is a very, very costly affair. I mean, 3 times, 4 times costly than whatever is available with the Lindas and Inox and Goel gas. But here, what I suggest, a certain amount of the oxygen should be available with the oxygen hospital, but government must arrange. Because see, the amount was about 5 times higher. 8,000 liters liquid medical oxygen was required per day in my hospital. I cannot have a plant with the 8,000 liters. The supply has to be there when there is an epidemic or a pandemic and whenever there is an emergency situation. And especially corona pandemic, which we are expecting ki third wave aane wala hai. Third wave delta variant, delta plus, बहुत तेजी से भागता है, बहुत तेजी से इन्फेक्ट करता है. अगर लंग में चला गया तो लंग को बिल्कुल खा जाता है. दुनिया भर के ट्रीटमेंट को रेजिस्टेंट है. Even that cocktail of antibodies
it's not working.
Is resistant. See, in that case, when we are expecting, government must think of one thing, that there has to be enough beds available for COVID. Not the transformation of a normal beds to the COVID beds at the cost of a normal patients. You know, the sudden in the emergency, every day 4 or 5 broad dead patients they started coming because they were not getting bed. Dr. Bhagat, do you agree with me?
Agreed. Every day this was happening. Bodies were coming in 3-wheelers. They were not getting ambulance. They were coming in 3-wheelers.
Suffering from terminally cancer, suffering from any other disease, not coming to the hospital because there is no bed and they are dying ideally at home. Bringing the patient at the last time to the hospital, getting the death certificate made in the hospital at the cost of these COVID beds. So number one, there should be enough number of COVID beds with facilities to be available by all the governments. Number two.
What you are, yeah, please go ahead, sir. First finish, sir.
Number two, for essential things like oxygen, you should have a plan. If you know that there will be 30,000 cases and you are planning for 30,000 cases and 30,000 beds, then you have to have number of 200 hospitals, for example, and they are producing 2,000 liters per day and the demand is 30,000 liters, then you will have to see 28,000 liters of liquid medical oxygen per day from where you will be achieving it. So Delhi itself must start manufacturing liquid medical oxygen, number two. Number three is a big state. Now, what was the problem we have faced this time? There was hardly liquid medical oxygen was available, but is not able to reach that where this is needed. So there has to be a proper supply chain to be maintained. Number four, as Dr. Bhagat said, this should be today. I mean, हम लोग चांद में जा रहे हैं और हम अपने पेशेंट को उसका बिस्तरा एक जगह से नहीं दे पा रहे. एवरीथिंग इज बिकमिंग ऑनलाइन. ड्राइविंग लाइसेंस ऑनलाइन, ये लाइसेंस ऑनलाइन, होम थिंग ऑनलाइन, रजिस्ट्रेशन ऑफ लैंड इज ऑनलाइन, हाउस टैक्स ऑनलाइन. Why not the patient bed is online? Forget about the COVID time.
Why you mean availability of bed?
Why this is not available even today? If anybody who has got an emergency and needs an ICU, again you will have to go to the hospitals. Bed hai, nahi hai. Bed hai, nahi hai. Why? There should be a centralized system at one place where all ICU beds should be mentioned here. There are 1,000 ICU beds, suppose, and there is a one khali bed here. That depends on if you can afford. The choice is yours. You can go to the private hospital. You can go to the government hospital. That is your choice. Of course, then a manpower. This time, first time there was a lot of enthusiasm with the healthcare workers. Second times, they were exhausted. Number of deaths, more than 1,500 doctors. How many health workers? Lot of. This is the Indian Medical Association figure. Lot of people they have died. Nobody knows. and it's a sort of a fear also developing to the healthcare worker, because hardly nobody is bothered about the healthcare worker. एक जगह भाषण दे देने से healthcare worker का कुछ नहीं होने वाला. Who is bothered about the healthcare workers here?
So we are bothered, and that is why we are doing this exercise, because we want to thank them.
No, thank you very much. Thank you very much. Not for you, Anisha. Those people who are responsible for, they are not bothered. And third wave is coming, exhausted medical health workers. From where you will be getting the healthcare worker in the third wave? Dr. Bhagat, do you agree with me?
Yes, there is going to be an issue of healthcare workers.
Shortage of healthcare worker in the third phase.
And that is why the Skill Development Council has come up with a plan.
We have seen the problem of nurses. We have seen the problem of ayas. We have seen the problem of ward boys. They hardly available. Nobody wants to go to these people, these patients or COVID patients, the COVID wards, to perform a 6 hours duty in a PPE kit. Is a hell of a job. Talking in air-conditioned room and making rules and regulation and sending every day one circular to the hospital.
Three circulars minimum. Three circulars minimum every day.
Three circulars.
Right. So what you are proposing is that you have the control room now, even before the anticipated third wave coming in. Do you think that should be the case, Dr. Bhagat? Because after the first wave, the Chhatarpur COVID center was dismantled, and then suddenly you have so many patients coming up. So, Dr. Bhagat, you were saying that there should be COVID centers, large ones, all over the city, and the control room should have updates of their tests, their status, and only the those requiring hospital care should be moved to regular hospitals, and regular hospitals should not be designated COVID hospitals. Is this what you say?
Something I would like you to go through the report of Mumbai Municipal Commissioner. His interview is also there on the net, and I had gone through it twice because I liked his approach. He was not critical of anybody. He just wanted to provide service. So he provided service. If you are critical of everything which is supporting you, you are critical of central government, fine. You are critical of the service provider, fine. You keep on threatening service provider, fine. You see, healthcare has suffered a lot. People think the hospitals were full, they have minted money. Some hospitals may have minted money. Mumbai hospitals, they suffered a loss of 700 crore rupees in this last second wave of COVID because they gave subsidized bed to the government. And that attitude will still continue. But stop criticizing the people who are providing service rather than people who are sitting in their air-conditioned rooms. Dr. Gupta rightly mentioned, they are giving orders, sitting in the air-conditioned rooms. People who are providing service, they are not even being asked, what is your problem? Has anybody asked me in last 3 months, what is my problem? Nobody has asked me. I keep on receiving orders every day. I keep on sending threatening letters to them. They keep on answering. They don't answer. But yes, only 3 days back, they reduced the number of COVID beds. Whereas it's almost a month since the COVID beds, 90% COVID beds were lying vacant. So if the system was interactive with the service provider, you see, who is providing service? Not the officers who are sitting in their room, not the officers who are communicating to the politicians, but people who are in the ground, on the ground, somehow begging their staff, somehow begging their doctors to provide service, getting the vendors to deliver the things. I told you I'll show you a picture of mine standing at the. You see, this is the picture.
I can see it.
This is at 1 in the night. So you see, you must ask these people what is the requirement. They don't want to ask. They keep on giving orders. I would call such administration. I am a student of management by experience and by training also. System has to interact with the person who is providing. They have not learnt it. They have not learnt it even now. They still keep on ordering people. Who said the third wave is going to be a replica of the second wave? Nobody can guarantee that. Third wave may be lesser or it may be much more severe than this. So unless you interact with the system, they have not taken. they have taken 15 reports from me every day of what they wanted. But they have never asked me or Dr. Gupta what was my problem. They have never asked till date. 15 reports every day. We start at 7 in the morning, start sending the reports. They want reports every 2 hours of the status of bed. You see, if they had the status report of the number of beds, why did they take 1 month to decrease the number of COVID beds in the hospital? And what Dr. Gupta has been crying that non-COVID patients have to be treated. Suppose I start using those COVID beds and there is another surge. They will blame me that why did you use these COVID beds without my permission, without our permission? And non-COVID patients are waiting outside the hospital. So that is the type of system we have. See, management is very clear. The rules are very clear that you interact with the various stakeholders and find a solution. If you don't know the solution, interact with the stakeholders. They will give you some ideas and you pick up the right ideas and then deliver it. But do they want to do that?
Is there any move to do this, to bring in the consultative?
No, it is not there. I'm a member of the various associations, AHPI, CAHO, and DMA, IMA. Dr. Gupta is also part of many associations. There is no move. But yes, the good move, which I was just mentioning also, that the central government has started with the help of skill development department. They are trying to train various skilled workers to help in the COVID time. In case the third wave is there, they are training. They have started the process, but still the enrollment of these people has not been done. Once that is done, they have to be registered and they have to train them. We have to train them, give them 200 hours of training. Once we do that training, we will have possibly more healthcare workers who can be frontline workers. That's the right move. And such move should be there. Oxygen, as I mentioned, 390 metric ton of storage has been created for Delhi. Very good move. 6,000 cylinders have come into Delhi, but I hope these cylinders are given to the right places rather than being hoarded and used politically. Because in the last second wave, I got a lot of political communication. हमारे पेशेंट को बेड दे दो, तुम्हारा पेशेंट तुम्हारा सगा, मेरे पेशेंट जो बाहर गेट पे खड़े हैं, क्या मैं उनकी परवाह नहीं करूंगा? So I hope this. Definitely, I can't do that. Patient who is waiting at my gate, I have to prioritize that patient. I cannot take a patient somewhere, somebody who has because some politician has given me a call. Very difficult for me to do that.
Right. So, Dr. Gupta, we've heard a lot of operational challenges that you have faced, and as of now, we're not really, from hearing both of you, not really seeing a very positive picture for any future wave that comes across. If the management is not going to change, perhaps the scenarios will be similar. Now, what about the human side of handling patients, caregivers when the patient has died or there's no oxygen? Do you ask them to bring oxygen? Can that be done? What about the doctors and the nurses and the staff that is so stressed? Don't you get calls that don't they tell you that we need a break? How do you manage the human side of this this whole overwhelming situation?
Of course, Anisha, अभी भी ये सोचने में डर लगता है. I told you before also. I remember the 1st of May, Saturday. Since morning, lot of serious patients were there, and we are lacking oxygen. You have seen the patient and the colleague dying because of a lack of oxygen. You cannot explain to yourself also that in 21st century, the patients, they are dying, they must be father of somebody, they must be brother of somebody, sister of somebody, mother of somebody. How you are going to answer? There was an ICU. You have seen the patient oxygen concentration is 95%, gradually coming to 40%, and suddenly your colleague is no more. What you can do except cry? The sisters, the ward boys there, they was crying. Doctor Sahab, kuch kariye. This was the one aspect. And another aspect was, when I was sitting in my office, it was surrounded by about 200, 300 patients, relatives, and attendants. Today is the time of social media and the media days. Anybody who was admitted in the hospital, they were also knowing कि ऑक्सीजन की कमी हो रही. उन्हें भी पता था बत्रा अस्पताल में 6:30 बजे से लेकर 11 बजे तक ऑक्सीजन कमी हो गई है, ऑक्सीजन खत्म होने वाली है, because everything was coming in the news. Think of your own position as a patient if you are lying और आपको ऑक्सीजन लग रही है और आप सोचेंगे कि अब मैं क्या करूं, जैसे हार्ट बीट. डॉक्टर साहब हम अपना सिलेंडर लाते हैं, डॉक्टर साहब हम अपना सिलेंडर लाते हैं. At the same time that the agitated crowd outside my office. You never know how the crowd is managed. One small spark is going to damage everything. And suddenly that savior had to run off to some place. Just I never want to face that crowd. Genuinely they were asking for, do something for us. Doctor Sahab, why you haven't told me before? We'd have brought. I know that they cannot do anything. मुझे पता है कुछ नहीं हो सकता था. कहीं सिलेंडर किसी को ढूंढे नहीं मिल रहा था, वो कहाँ से लाता. पर वो भी कहता था मुझे आप बता देते तो मैं सिलेंडर ले आता. डॉक्टर साहब मरती तो नहीं मेरी माँ.
डॉक्टर गुप्ता ने बिल्कुल ठीक कहा है. ऐसा सीन हमने बहुत बारी फेस किया. वेरी ऑफन वी फेस दिस थिंग. वन लेडी एवरी डे दिस वाज हैपनिंग एवरी डे. And fortunately, some patients survived, some who didn't survive, they had all the complaints. Anisha, more complaints will come.
Bhagat ji, just because of those few patients, those survived, there was the biggest consolation for us. अगर 2 की डेथ हो गई है तो 20 बचे भी हैं, और उनकी शक्ल देख करके हम अपने आंसू रोकते थे और अपने आप को महान समझते थे कि अच्छा हुआ हमने इतना काम कर लिया, इसका बच्चा बच गया. An amount of a feeling when we were discharging the patient that is being discharged in a good condition, that was the victory for us.
Yes, definitely. A recovered patient would be something anybody would be proud of. But we're coming towards the end of this discussion, and it's very heartbreaking. And I mean, I cannot even begin to imagine the staff and the administrators dealing with this. I mean, when a patient comes to your hospital, you want them to get good service. You want them to be happy when they go back. And this was obviously not what anybody would want. But from here, how do we go ahead? Dr. Bhagat, you're still saying that there is no feedback mechanism from the people who run hospitals on what should be done. How can we then just, sit with the hands one on the other and wait for the next wave to come? Where is the planning? Is it happening?
Okay, as you said, as I mentioned, there is no feedback. But if you ask the administration, they say we are collecting 15 reports every day. This is the feedback mechanism. Now, why they were collecting these 15 reports? Because they have to submit the data to the Delhi High Court. See, so that there is a difference in actual feedback, what my grievance is and what you are asking me to provide. Definitely, you started with this last question you asked, Dr. Gupta, was how did you manage the staff? I will tell you how I managed. I am 66. I am diabetic, slightly overweight also. By all rules, I should not be entering the COVID area. But I was spending 2 hours every day motivating my staff and patients also, making them smile also. Please keep on working. Please have faith. You will survive. So they were working. We provided them with insurance cover also. All the staff was insured just at the beginning of this wave. And they were assured that we will take care of their treatment. And anybody who was falling sick, we were taking care of that person. Motivation is what is required when you're sitting in the management chair, and if you give orders, they would not have listened. But if I was walking amongst them, holding their hands, they were working. They were working, they were doing 12 hours duty, they were doing 15 hours duty. They were ready to do even 24 hours. And fortunately, good survival, but good number of people died also. Some patients have sent me letters and videos showing the condition of their patient, how they are now. Particularly one patient, a pregnant female who had been given a zero hope. She went back with the intact pregnancy after about 45 days of stay. So those videos, yes.
That's amazing.
So, yes, the good points are there because achievements also give you a lot of satisfaction. These achievements are there, but I would like to move forward and be more prepared for the next wave. And better equipment, yes, there have been a lot of talks of providing more things to us. But my main grudge is that somebody should understand how I am providing service, rather than they trying to tell me how you provide service. That is something which has to be talked.
And how do you get the message across? Will you talk to your associations, get together, try to pressurize the government? Because you don't want to be in the same spot again, right?
They will not listen to me. They will listen to Delhi High Court.
But you
now,
have
I have never seen such administration anywhere in the world, where the court is deciding based on some plea by some NGO or somebody who has gone to court.
Bhagat, that is why Batra Hospital gone to the High Court.
Yeah, but the hospital is also going to the High Court.
I know. And you see, two things, before you close, I would like to raise 2-3 points, and I'll go to the previous session also, vaccination also. I'll take just 2 minutes of that because there is something which has not been discussed in that session. I was listening to the last part of it. One, in the beginning of this, the big corporate hospitals were short of oxygen. They made a lot of noise. After that, not on a single day, those people who could manage the things and who could pull the strings, they faced the oxygen shortage. The oxygen shortage was there in the small and medium hospital. And out of the bigger hospitals, Batra Hospital was one which faced oxygen shortage for 1 day. I faced it for 15 days. And Shanti Mukund, which faced it for
not for 1 day, for 3 weeks.
No, but that acute crisis, the media coverage.
Three times.
So I was wondering how come this corporate hospital is not able to pull the strings, whereas the other corporate hospitals are able to pull the strings. So somewhere the money power was talking. Somewhere the money power and the contact was talking. I wanted to go back to vaccination and just wanted to convey. Prime Minister said 25% to the private hospitals. And in the beginning, that was later on, in the beginning, 1.25 crore doses were picked up by the big corporate hospitals. I am dead against this system. That and how much vaccines they have used. Somebody should question them. How much vaccine they had used. About 10 days back, I saw a report only 23 lakh doses has been used and remaining doses out of 1.25 crore are still lying with them.
Still we don't have any vaccine.
Yes, that is what I'm coming to that. Now, out of this, after that, Prime Minister intervened, and I had also given a social media post which had circulated. After that, incidentally, Prime Minister came on the TV and he declared 25% dosage will go to the private sector. Till date, the system has not been put in place to deliver that. My management is struggling. Dr. Gupta's management is struggling. Yesterday, they opened the portal. Portal is still not working. How many days since Prime Minister has made this statement? I don't know who is at fault. Here, I feel that it's the central government which is at fault. Where is that 25% dosage which were to be given to the private sector who are sitting? You see, these small and medium hospitals, they are in every nook and corner of India.
36 days has gone past.
Every nook and corner of India. Why they have not been given this vaccine to be given to their patients? You see, my patients approach me. They keep on calling me. And in the government centers, every day there is shortage of vaccine. And somebody made a very nice statement from the ministry. It's a marathon which we are running. It is not a sprint that you have got something and you finished every day and then keep on making noise. So we have to understand this marathon and we have to cover all segments of the population. And for that, my request is, please give me those 25% vaccine which I am entitled to. And me means my colleagues, Dr. Gupta and other hospitals, big corporate hospital, 10 hospitals in the whole country, they have pocketed those 1.25. There should be an inquiry on that. Why the other hospitals did not get that vaccine which these people. Very serious issue. Very serious issue. Somebody has to answer that.
Thank you. Thank you.
Yes, I mean, this is coming to the fore, I think, for the first time. We were thinking that now, so many millions of vaccines have been given. The situation is quite good for everyone, but a systematic distribution of vaccine is one, a good suggestion coming in from Dr. Bhagat. Dr. Gupta, what would you like to see? You don't want to be in the same situation again. Oxygen should not be something that should run short for a patient, or even medicines for that. How can we manage future crises better? What is required? Is it the court intervention? Because that also comes to later.
See, the first thing is that the third wave should be checked. And that can be checked only by triple T's. Trace the patient, treat the patient, vaccinate everybody, follow self-distancing, follow social distancing, masking everybody, and government should follow that. These days Delhi government is following that. आज लाजपत नगर मार्केट बंद हो गया, कल सदर बाजार बंद हो गया. जहां जहां भीड़ लगे, जो जो डिसऑनर करे उसके ऑर्डर को उसको पकड़े. And of course, suppose by all means, in case the third wave is coming, and third wave here, this will be professionally managed, as we have discussed, both of us, CM Bhagat and me also, that there has to be a system. First thing is, आपस दोनों में बात तो हो, सरकार में जो सर्विस प्रोवाइड कर रही है ऑन पेपर और जो सर्विस प्रोवाइड कर रहे हैं एक्चुअली, और फिर इसके बाद जो जो समस्याएं हैं उसकी, उन समस्याओं को तरीके से मैनेज करें, चाहे वो ऑक्सीजन की हो, चाहे ड्रग्स की हो, चाहे बेड्स की हो, कीपिंग ऑल द थिंग इन बैलेंस. पेशेंट्स, कोविड पेशेंट्स और नॉन कोविड पेशेंट्स, कोविड बेड्स, नॉन कोविड बेड्स, फैसिलिटीज, प्रॉब्लम ऑफ द हेल्थ केयर वर्कर्स, problem of the drugs, problem of the oxygen, and of course, problem of the patient, because they should have one window, single window availability.
Yes, very important.
Suppose I am coming to place A, then that place only I should know that where is the vacant bed is there, and I must immediately rush towards that hospital. रनिंग 10 हॉस्पिटल्स मार्केट में, मतलब आप सोच नहीं सकती हैं, पेशेंट एम्बुलेंस में 4-4 घंटे घूम रहे थे रात को 2 बजे, और हर हॉस्पिटल उनको भगा रहा था. किस समय कहां पर बेड मिल जाए वो उसके भाग्य पे होता था. इन सब चीजों से जो हमने अभी सीख लिया है, जो हमने अभी 1 घंटे पूरा डिस्कशन किया है, दिस शुड बी properly and scientifically managed, and Delhi government also in association with the hospital healthcare providers एक सिस्टम बनाएं, उस सिस्टम को फॉलो करें. और एक दिल्ली मॉडल होना चाहिए. दिल्ली मॉडल शुड बी द वन ऑफ द बेस्ट कंट्रीज मॉडल. Whatever the Lekhnas were there in Bombay model and any other else model, we should learn from this and create a Delhi model, so that in third wave, suppose in case is coming, we should not have such problems, and we should manage nicely and beautifully.
Let's hope so. Our fingers crossed. And thank you so much for coming in and talking about these very tough circumstances. And your suggestions are very welcome. They're positive. Everybody in Delhi is hoping that we find a way out so that next time we are not brought to our knees again. Thank you so much. We hope that consultative process will start. We have a good healthcare system in our country. We want to thank you for taking the time for coming here and sharing your views. But before anything else, we want to say thank you from the bottom of our heart for all the work you've done.
Thank you, Anisha. Thank you very much.
Thank you.
For
Thank
patients, for caregivers, for your own doctors, we have an anthem that we want to play. From our heart, we are saying thank you to all the healthcare heroes who performed exemplary service over the last year and a half. Please hear it.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
For their selfless work that has brought smiles to the lives of many people. We want to thank you for the care that you have given to everyone. I would now like to hand it over to Rajiv Kumar, Director Communications Forum and Network Integrated Health and Wellbeing Council, to take us to the next step. Over to you, Rajiv.
Thank you, Richard. Thank you.
करेंगे तो दूसरी तरफ चिकित्सक और चिकित्सा कर्मी की सेवा को, उस अहर्निश सेवा को कभी भी नहीं भूल सकते. तो मुझे विश्वास है कि हमारे जो ऐसे कोविड वॉरियर्स जिन्होंने अपने प्राण की आहुति दे दी, मैं ऐसे बहुत सारे अच्छे अच्छे डॉक्टर को जान रहा हूँ. इसलिए आपने जो कहा है इसको निश्चित रूप से मैं अपने ऊपर जिम्मेवारी पूर्वक इस बात को कैसे आगे बढ़ा सकते हैं, मैं जरूर विश्वास करिए कि मैं इसको बढ़ाऊं.
आप मेरी ओर से, मेरे मंत्रालय की ओर से ये सभी फ्रंटलाइन फाइटर को उनका मैं अभिनंदन करता हूं, उनको धन्यवाद देता हूं. जिस तरह से उन्होंने इस पैंडेमिक में काम किया, ये तो सराहनीय काम था. और इनके वेलफेयर के लिए जैसा आपने कहा कि आयुष मंत्रालय कभी पीछे नहीं रहेगा, हम हर रोज आपके साथ रहेंगे, यही मैं आपको कहना चाहता हूँ।
तो कोरोना योद्धा के नाम पर अगर ये डॉक्टरों का अगर एक मेमोरियल हो जाता है, बहुत ही अच्छी बात है। आपका सुझाव बहुत अच्छा है। मैं हेल्थ मिनिस्टर डॉक्टर हर्षवर्धन से बात करूंगा। माननीय प्रधानमंत्री नरेंद्र मोदी साहब को भी एक पत्र में लिखूंगा, और बहुत सारे डॉक्टरों ने लाखों लोगों की जान बचाई है। इसलिए कोरोना योद्धा के नाम पर डॉक्टरों का एक मेमोरियल जो है, इनकी डेथ डॉक्टरों की हुई है, ऐसे डॉक्टरों का एक मेमोरियल जो है, ये मेमोरियल बनाने के लिए जरूर भारत सरकार की तरफ से जरूर हम कोशिश करेंगे।
Common man has so much faith in doctors. Ever since I've grown, like I can talk about my parents, me, children. Doctors are your first contact, and you always contact them, and there's a very long emotional relationship with them. So definitely there has to be a celebration around it. There has to be. So we will do that celebration around it also.
Dr. Kamal, I have noted down your point, and whenever you actually put across this proposal, kindly also keep me in the loop. We can approach the Honorable Health Minister Dr. Harshvardhan, who is himself a very senior medical professional, and in fact known in India as the man behind the Pulse Polio program. And I'm sure he understands the nuances of all that we are discussing. And I'm sure we could be able to carry it forward. Very noble thought of yours.
Good afternoon, everyone. This is Rajiv from IHW Council. And I'm sure you're enjoying the national tribute to our doctors and healthcare workers and our India's longest Thanksgiving marathon. We started on the Doctor's Day, 1st July, and it will continue till tomorrow, 7th. We're really overwhelmed by the response we are getting from all over India, from the entire healthcare fraternity. And it is so amazing to see so many professionals talking about recent developments and the challenges we are facing. It is the kind of experience they are sharing. We have been having very good session and very informative sessions on vaccines and how medical kit is being distributed and what kind of shortage we have, what kind of challenges doctors and these hospitals are facing. And it is saddening, but yes, we see our healthcare workers have been, really tied up and 24/7 they're working. So this tribute definitely will going to help them, give them some little relief, and efforts of everyone, including a lot of artists, school kids who will be performing now through our Harmony program. This Harmony is also another tribute, but we have a musical tribute, and a lot of school kids, artists perform in this. So to continue this harmony, to give little relaxing time to our doctors and healthcare workers, we would like to continue with the session. And I would like to invite, we have with us today our very young and talented Bharatanatyam artist, KP Aditi. And she's a disciple of Guru Kalaima Mani Pandaniluru S. Pandyan, renowned Bharatanatyam dancer, and she's been trained by her, and she'll be performing for us today. So I would request my team to play her performance.
Shri Gurubhyo Namaha, Namaskaram. I am KP Aditi, disciple of Guru Kalimamani Pandanallur S. Pandyan sir. It is a great privilege for me to give a brief performance as a tribute to doctors in the Gratitude Week celebrated IHW Council. I'm filled with immense gratitude to all the doctors for your sacrifices. We admire your dedication and services and thank you from bottom of our heart. Today, I will be commencing my program with Ananda Nartana Ganapati, a Kriti on Lord Ganesha as a Vandanam in Ragam Nate, Thalam Adi, a composition of Utkada Venkatagiri.
आनन्दनर्तन गणपतिं भावये आनन्दनर्तन गणपतिं भावये आनन्दनर्तन गणपतिं भावये सदा Parama Nartana Ganapati Bhavaya Paramanandana Ganapati Bhavaya Shirakara Mooladhara Omkara Gajavadanam Paramam Paramanandana Gajavadano Paramo Paramananda Ganapati Bhavaya Chidakara Mooladhara Omkara Gajavadano Paramo Paramananda Ganapati Bhavaya Chidakara Mooladhara Omkara Gajavadanam Paramam Paramanandana Ganapatim Bhavaya Sananda Munindra Gananuta Shiva Shankara Manasa Niliyamanam Sananda Munindra Gananuta Shiva Shankara Manasa Niliyamanam Tantrikaya Samavita Galdharva Sharana Varanu Giyamanam Tantrikaya Samavita Galdharva Sharana Varanu Giyamanam Yena Janamadaram Anupama Divya Kalevana Shobhayamanam Yena Janamadaram Anupama Divya Kalevana Shobhayamanam Vasamanam Asamanam Bhajamanam Bhaktajana Sammanam Vasamanam Asamano Bhajamano Bhaktajana Mano Pamakama Risasani Sadisa Kirajana Gujana Takatolongu Takapo Pamakama Madisa Sani Sadisa Kirajana Gujana Takatolongu Taka Dinuta Dinuta Tanam tarita Takatanam Tanam tarita Tam Tanam tarita Takatanam Tanam tarita Tam Tanam tarita Takatanam Tanam tarita Tam Tanam tarita Tanam tarita Dari 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 Gita 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 पदिनुतं पदसरसिजं मगपमनिप मरगदनिभं मदकरिमुगं प्रणवनिनदम् अजितम् अनकं सुभतं परमं कनकाभरधरणम् एकदन्तं तत्तिक्तकदटं तणकददिक्तकदटं तणकददितकदणं तणकदरिता तत्तिक्तकदटं तणकददितकदणं तणकदरितकदणं तणकदरितै तत्तिक्तकदणौ तणकदरितकदणौ तणकदरितकदणौ तणक परमानन्दन तनगणपति पावये चिदाकारमूलाधार ओंकार गजवदनो परमौ परमानन्दन तनगणपति भावये चिदाकारमूलाधार ओंकार गजवदनो परमौ परमानन्दन तनगणपति भावये
Now I will be continuing with a Kirtanam on Lord Shiva. In this Kirtanam, I will be depicting a story in which Markandeya, a 16 years old boy, his life is in danger. There arrives the Yamadharmaraja, god of death, in his bull, and for taking off his life. Markandeya ignores him completely and worships Lord Shiva. Lord Shiva saves Markandeya's life. God cannot be everywhere, so he has sent doctors as his representatives. In this pandemic situation, doctors are saving our life. Adikondar and the Vedike Kana in Raga Maya Malavagola, Thalam Adi, a composition of Muttuttandagar.
ஆடிக்கொண்டாரந்த வேடிக்கை காண கண் ஆயிரம் வேண்டாமோ நடமாடிக்கொண்டார் அந்த வேடிக்கை காண கண் ஆயிரம் வேண்டாமோ நடமாடி கொண்டார் அந்த வேடிக்கை காண கண் ஆயிரம் வேண்டாமோ நடமாடி கொண்டார் அந்த வேடிக்கை காண கண் ஆயிரம் வேண்டாமோ ஆடிக்கொண்டார் அந்த வேடிக்கை காண கண் ஆயிரம் வேண்டாமோ நாடி துதிப்பவர் பங்கில் உறைபவர் நாடி துதிப்பவர் பங்கில் உறைபவர் நாடி துதிப்பவர் பங்கில் உறைபவர் நாடி துதிப்பவர் பங்கில் உறைபவர் நம்பர் திருச்செம் பொன்னம்பல வாண நாடி துதிப்பவர் பங்கில் உறைபவர் நம்பர் திருச்செம் பொன்னம்பல வாணராடி கொண்டார் அந்த வேடிக்கை காண கண் ஆயுதம் வேண்டாமோ ஆடிக்கொண்டார் அந்த வேடிக்கை காண கண் ஆயுதம் வேண்டாமோ. ஆரணவ மணிமாலைகளாட ஆடும் மரபம் படம் விரித்தாட சீரணி கொன்றை மலத்தொடையாட சிதம்பரத்தே நின்றாட ஆரணவ மணிமாலைகளாட ஆடும் மரபம் படம் விரித்தாட சீரணி கொன்றை மலர் தொடையாட சிதம்பரத்தே நின்றாட ஆரணவ மணிமாலைகளாட ஆடும் மரபம் படம் விரித்தாட சீரணி கொன்றை மலர் தொடையாட சிதம்பரத்தே நின்றாட பேரடி வேதியர் திண்ணை 3000 பேர்களும் பூஜித்து கொண்டு நின்றாட தாரணி காளி எதிர்த்து நின்றாட காரணி காளி எதிர்த்து நின்றாட கனக சபை தனிலே ஆடி கொண்டார் அந்த வேடிக்கை காண கண் ஆயுதம் வேண்டாமோ அந்த வேடிக்கை காண கண் ஆயுதம் வேண்டாமோ.
Doctors, you all are heroes and unsung heroes of the humanity. This is a tribute to all the doctors, healthcare workers and the nurses. This is a special anthem sung by Padmajit sir for this occasion last year.
किया क्या बात है मुश्किल में डटे रहे क्या बात है खुद की नहीं परवाह की क्योंकि पेशेंट्स के हेल्थ की चिंता थी डॉक्टर्स नर्सेस मेडिकल स्टाफ आपका शुक्रिया
thank you, IHW Council, for this wonderful opportunity. Thank you so much.
He was such a lovely performance. What a talent. So natural, flawless. I think you have a long way to go, and thank you for this amazing tribute. We really appreciate your gesture for our healthcare worker and doctors, and thank you once again. So, audience, we have another performance by Mayur Sivan. Mayur Sivan is a very dynamic performer, and is a very good singer, very talented upcoming singer. He sings, a lot of contemporary music, songs, and perform at various festivals in India on national level. A young guy, and he would like to dedicate his performance to our doctors and healthcare workers. So I would request my team to next play Mayur Sivan.
Hello everyone, my name is Mayur Sivan. First of all, I would like to thank IHW Council for inviting me. It is an honor for me to perform for our doctors and health workers. Today I have prepared a set of songs and I'm hoping that you're gonna love it. So here I go. आपकी नजरों ने समझा प्यार के काबिल मुझे दिल की ये धड़कन ठहर जा मिल गई मंजिल मुझे आपकी नजरों ने समझा प्यार के काबिल मिल गई मंजिल मुझे जी हमें मंजूर है आपका ये फैसला जी हमें मंजूर है आपका ये फैसला कह रही है हर नजर बंदा परवर शुक्रिया दो जहां की आज खुशियां हो गई हासिल मुझे आपकी नजरों ने समझा प्यार के काबिल मुझे और पिया है और पिया और पिया तेरा तिस ये दिल की पतंग को काटे है तुझी से कटके ये गिरे तेरी छत पे आके हाय ओ हो है मांझा तेरा तिस ये दिल की पतंग को काटे हाय तुझी से कटके ये गिरे तेरी छत पे आके हाय मेरी जान चली जाए है तू जो मुड़ के देखे हाय तुझी से कटके ये गिरे तेरी छत पे आके हाय ओ तितली थी मैं बावरी सी इधर कभी उधर कभी कैसे आ ठहरी तेरी छत पे आके है मनमानियों से है नजारे क्या दरमियां है ये हमारे हो मनमानियों से है नजारे क्या दरमियां है ये हमारे दिल कागज का एक पंछी तू अंदर सारा है तुझे जो देखे तो ये फुर फुर उड़ ही जाए हाय है मांझा तेरा तिस ये दिल की पतंग को काटे हाय जब तेरे पास मैं आया एक सुकून मिला जिससे मैं था भूलता आया वो वजूद मिला जब आए मौसम गम के तुझे याद किया हो जब सहमे तन्हापन से तुझे याद किया संभल जा जरा फिर मोहब्बत करने चला है तू यही रुक जा जरा फिर मोहब्बत करने चला है तू जब कोई बात बिगड़ जाए जब कोई मुश्किल पड़ जाए तुम देना साथ मेरा ओ हमनवाज ना कोई है ना कोई था जिंदगी में तुम्हारे सिवा तुम देना साथ मेरा ओ हमनवाज हो चांदनी जब तक रात देता है हर कोई साथ तुम मगर अंधेरों में ना छोड़ना मेरा हाथ हो चांदनी जब तक रात देता है हर कोई साथ तुम मगर अंधेरों में ना छोड़ना मेरा हाथ ना कोई है ना कोई था जिंदगी में तुम्हारे सिवा तुम देना साथ मेरा ओ हमनवाज जब कोई बात बिगड़ जाए कभी कभी मेरे दिल में ख्याल आता है, कभी कभी मेरे दिल में ख्याल आता है कि जैसे तुझको बनाया गया है मेरे लिए, कि जैसे तुझको बनाया गया है मेरे लिए। तू अब से पहले सितारों में बस रही थी कहीं, तू अब से पहले सितारों में बस रही थी कहीं, तुझे ज़मीं पे बुलाया गया है मेरे लिए। कभी कभी मेरे दिल में ख्याल आता है, सांसों में तेरी नजदीकियों का इत्र तू घोल दे, मैं ही क्यों इश्क जाहिर करूं, तू भी कभी बोल दे, जो तेरी खातिर तड़पे पहले से ही क्या उसे तड़पाना। ओ जालिमा, ओ जालिमा, जो तेरे इश्क में बहका पहले से ही क्या उसे बहकाना। ओ जालिमा, ओ जालिमा, आंखें मरहबा, बातें मरहबा, मैं 100 मर्तबा दीवाना हुआ, मेरा ना रहा जब से दिल मेरा तेरे हुस्न का फसाना हुआ। तू ही मेरा मेरा मेरा, तू ही मेरा मेरा मेरा, तू ही मेरा मेरा मेरा, तू ही मेरा मेरा मेरा। ओ है तेरी चाहत मेरी जरूरत, सोनी है तुझ बिन दुनिया मेरी, ना रह सकूंगा मैं दूर इनसे, ऐ मेरी जन्नत गलियां तेरी। उम्मीद ऐसी न मिले कि मैं हूँ जी रहा, कभी तू मिले मुझसे कहे कि मैं हूँ बस तेरा। तू ही मेरा मेरा मेरा, 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 तू ही मेरा, तू ही मेरा। सुभान अल्लाह, हो सुभान अल्लाह। एक दिन कभी जो खुद को तराशे मेरी नजर से तू जरा, रे आंखों से तेरी क्या क्या छुपा है, तुझको दिखाऊं मैं जरा। एक अनकही सी दास्तां दास्तां कहने लगेगा सुभान अल्लाह जो हो रहा है पहली दफा है वल्लाह ऐसा हुआ सुभान अल्लाह जो हो रहा है पहली दफा है वल्लाह ऐसा हुआ. Thank you so much for having me here. Thank you so much. Hello everyone, my name
Rajiv will live.
Thank you very much for an amazing performance, Sivan. And you really have a very good, deep voice. Thank you for your contribution. And I think all the doctors must have enjoyed, and they will definitely enjoy this performance. Your tribute to healthcare guardians. So continue this harmony program. Next performance, we have Staccato as a Chennai-based band. And we are really thankful for their performance. They have performed amazing, very popular numbers here. Their genre is contemporary again, classical, mix, and it is very mesmerizing and experience listening to this band. They've been performing all over India on major festivals. Today they'll be performing for our doctors and healthcare workers. So over to the performance.
జరిపే ముచ్చటగనరే వనితలార నేడు ఓడను జరిపే ముచ్చటగనరే వనితలార నేడు ఆడవారు యమున కాడా ఆడవారు యమున కాడ కృష్ణుని గూడి ఆడుచు పాడుచు అందరూ చూడగా ఆడవారు యమున కాడ కృష్ణుని గూడి ఆడుచు పాడుచు అందరూ చూడగా ఓడను జరిపే ముచ్చటగనరే వనితలార నేడు కొందరు హరి కీర్తనములు పాడ కొందరు ఆనందమున ముద్దులాడ కొందరు హరి కీర్తనములు పాడ కొందరు ఆనందమున ముద్దులాడ కొందరు యమునా దేవిని వేడ కొందరు ముత్యపు సరులసియాడ ఓడను జరిపే ముచ్చటగనరే వనితలార నేడు ఓడను జరిపే ముచ్చట గనరే अरे रे ला 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 ला। जिस रोज से देखा है उसको हम शम्मा जलाना भूल गए, दिल थाम के ऐसे बैठे हैं कहीं आना जाना भूल गए। जिस रोज से देखा है उसको हम शम्मा जलाना भूल गए, दिल थाम के ऐसे बैठे हैं कहीं आना जाना भूल गए। अब 8 पहर इन आंखों में वो चंचल मुखड़ा रहता है, मेरे सामने वाली खिड़की में एक चांद का टुकड़ा रहता है, मेरे सामने वाली खिड़की में एक चांद का टुकड़ा रहता है। अफसोस ये है कि वो हमसे कुछ उखड़ा उखड़ा रहता है, मेरे सामने वाली खिड़की में एक चांद का टुकड़ा रहता है, मेरे सामने वाली खिड़की में एक चांद का टुकड़ा रहता है। रूठे तो हुजूर थे मेरी क्या खता, छोटे से हुजूर पे ऐसे हो खफा। रूठे तो हुजूर थे मेरी क्या खता, अरे देखो दिल न तोड़ो, छोड़ो हाथ छोड़ो, अरे देखो दिल न तोड़ो, अरे 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 छोड़ो हाथ छोड़ो, छोड़ दिया तो हाथ मलोगे समझे, आज समझे। अच्छा जी मेरा दिल जलाओ ना, अच्छा जी मैं हारी चलो मान जाओ ना, देखी सबकी हारी मेरा दिल जलाओ ना। क्यों भला हम डरे दिल के मालिक हम, हर जन्म मैं तुझे अपना माना सनम। क्यों भला हम डरे दिल के मालिक हम, हर जन्म मैं तुझे अपना माना सनम, हर जन्म मैं तुझे अपना माना सनम। आजकल तेरे मेरे प्यार के चर्चे हर ज़बान पर, सबको मालूम है और सबको खबर हो गई। आजकल तेरे मेरे प्यार के चर्चे हर ज़बान पर, सबको मालूम है और सबको खबर हो गई।
राम 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 त्याग राज हृदय सदन राम 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 त्याग राज हृदय सदन नामदि तल्लडिल्लगा नामदि तल्लडिल्लगा
ஆழிமழை கண்ணா ஆழிமழை கண்ணா உன் திரு அரவிந்த மலரடி சரணம் 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 ஆழிமழை கண்ணா உன் திரு அரவிந்த மலரடி சரணம் 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 வாழினின் நாமம் வாழினின் அடியார் வாழினின் நாமம் வாழினின் அடியார் வாழிய வாழிய வானோடு வையகம் வேதனை அழித்திடும் அரக்கிய தலைவி பூதனை புவிதனில் மாய்ந்திட அருளிய ஆழிமழை கண்ணா காளியன் சிறந்தனில் களி நடனம் புரிந்து காளியன் சிறந்தனில் களி நடனம் புரிந்து கேளிக்கையானவன் கர்வமும் நீக்கிய ஆழிமழை கண்ணா வீடுகள் புகுந்து வெண்ணையும் உண்டு வீடுகள் புகுந்து வெண்ணையும் உண்டு மாடுகள் மேய்த்திட்ட மாயவா தூயவா ஆய குலம் தனை ஆட்கொண்ட நாயகா தூய மனம் கொண்ட கோபிய காவலா ஆழிமழை கண்ணா ഹീന ദുര്യനിൻ സവൈതനിൽ ദുരുപதை മാനം காத்திட்ட மலர்விழி மாதவா தன்னடி சேர்ந்த பாண்டவர் நலம் பெற தன்னடி சேர்ந்த பாண்டவர் நலம் பெற பொன்னடி தேயவே உறுதுணை நின்றவா ஆழிமழை கண்ணா 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 ஆழிமழை உன் திரு அரவிந்த மலரடி சரணம் 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 ஆழிமழை கண்ணா ஆழிமழை கண்ணா ஆழிமழை கண்ணா 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 கண்ணா
By staccato, and that was, I believe, it was a new age interpretation of Carnatic classical kritis. Very well put together, the entire concept and show, and it was beautifully crafted. Thank you for this lovely dedication to our healthcare warriors. Now we have our Smartinian. Anisha will be hosting our COVID Samaritans. And I will hand over the show to Anisha.
Thank you so much.
30 minutes.
Thank you so much, Rajiv. The performance is really home of your heart. You feel so good when you're all stuck inside home, where this is a real good break for everyone. Now we want to move on to our next session. So I will welcome everyone again to another session of the Gratitude Week, which is, of course, from the 1st to 7th of July. We continue with a Thanksgiving marathon to thank our healthcare heroes for their untiring efforts in service to the nation during the hard times of a pandemic, and we will carry this gratitude in our hearts forever. We are now joined by two very special ladies who decided that just being armchair activists was not enough. When the country needed them, they stood up and volunteered their services. These ladies have helped those in need during the waves of the COVID pandemic and the subsequent lockdown. These good Samaritans have proved that it is only our humanity that will help us win this battle against the pandemic. Please welcome Sandhya Fernandez, strategist Derek Bhaskar, and Chaiti Narula, news anchor and deputy editor with India Today. A warm welcome to both of you ladies. Welcome to this session.
Thank you so much, and thank you for your kind words.
I would just like to give a brief introduction to both Sandhya and Chaiti. So, Sandhya is a brand strategist by profession and helped many people during the COVID-19 pandemic. In the first wave of the pandemic, she started the initiative as a volunteer in a group called SOS Saviors that helped many, which helped many people by distributing ration in many parts of Maharashtra. And this year, during the second wave, she helped people find beds, plasma donors, blood, online consultation for patients who needed preliminary advice. Then, Katie Nirula is one you would have seen on TV. She's a deputy editor with India Today. She has over a decade of experience in journalism. She appeals for humanitarian affairs and actively works on the United Nations Sustainable Development Goals in her free time. She has been covering the pandemic and also spreading awareness for fighting against misinformation. Warm welcome to both of you ladies. Let me start with you, Sandhya. Uh, you know, even at the time of the first pandemic, nobody knew anything about the virus. It was very scary because you were hearing horror stories. And the first thing that came to people's mind was protection, save yourself. So, what made you step out, help people with rations who were affected during the lockdown?
First of all, thank you for having me. I'm so glad that I'm part of the Gratitude Week. This is something we all hold very deeply in our hearts, is the thankfulness we have for the opportunities that we were bestowed with all throughout these 2 years of, the journey that we were in. And how it all started, Anisha's like quickly putting forward the migrant workers. When we started off with this whole pandemic story, I was busy traveling around. I was doing events and hosting my activities in Jalandhar, Panipat. There was a very there was a fear while we would cross airports and everything. But what was happening back in town, none of us knew the depth of it because we were concerned about our travel, about our health. But when I walked onto the streets, so there's this slum belt in my area, and when I went there one day, I was remembering one of the Pani Puri uncles that I used to frequently visit, and I didn't find him on the street. That is when it struck to me that, oh, these guys are not even going to be on the road, earning their bread and butter. This is all they know. This is all they've been doing. So how do they function going forward? And this was a casual conversation that I had the opportunity of doing with that uncle, remembering him for the kind of times we share before the pandemic period, how normal it was to just walk to the street and have street food. So when I visited his home, I saw his kids crying out of hunger. Now, the families, not all poor families seek help, not all go out there talking about their hardships. But when I saw that these kids did not know how food will be served in their homes because whatever they used to sell per day is what they used to earn, that is when it struck to me that we need to do something for these vendors who are currently not in our minds because we are busy coping up with a word called as COVID and pandemic. And we started a very small and humble initiative with three friends, trying to touch say about 100 vendors maybe across the slum belt because it kept adding the pani puri, then the vada pav wala uncles. And as in when we went to the slum, we realized there are these daily wage workers, all the widow aunties who used to clean the gutters and who used to do the civil work, pick the cement and bricks. They did not have a job. And then I met the widows, I met the maids. So the conversation kept adding, and we got the opportunity to understand that we were not the only one who were getting affected. There were people who were going to starve in days to come. And that is how the ration initiative started. I must thank all my friends because I did a small fundraiser. Once the communities kept adding, I asked my friends to help, and all of them were kind enough to come forward when they realized, oh, this is something that we didn't give a thought to. And soon we had covered up to 2,000 families of migrant workers, widows, and handicapped people within a month's time. And this is way before the lockdown was announced. So we had started touching people even before that. That's how this started. This is how the conversation began in the first place.
Right, and it's really exemplary work that a lot of us see this anecdotal things, feel really bad about it, but still not do anything because you were so afraid for your own lives. But Chetty is one who's always been very brave, and I must congratulate all my journalist friends. I've been a journalist myself. Exemplary work in covering the news, and going out in the field, in the front line, and many journalists have also lost their lives to this pandemic. So we must congratulate the entire beat of journalists who are doing a great job. Chetty, what made you do what, you know, how did you overcome your fear of COVID and continue doing the good service to the nation by bringing timely and verified news to people?
So that is one part of it, yes, that we ended up doing. What happened is there was a lot of misinformation that we saw floating around in the pandemic. There were lots of times that we used to receive messages from friends saying, hey, we've received this on WhatsApp and, the vaccination is going to be causing this or the vaccination is going to be causing that. It's leading to deaths of people. It's leading to this, that. And there was just so many myths around it. And this is just one part. And there were many other myths to do with COVID as well, whether it was with plasma treatment, whether it was with ECMO support, whether it was with mental health of people. And a lot of these ghar ka nuska therapies and myths floating around that do this and take this and you'll cure COVID. If your oxygen levels are dropping down, do some pranayam and, you're going to be fine and not going to be requiring medical assistance. And a lot of these WhatsApps were floating around and lots of misinformation out there on social media platforms, on WhatsApps as well. So when I used to get calls from my friends and family and extended family asking me, hey, what, is this true? Is this not true? And that's when the alarm bell went on, saying that there's just so much misinformation out there that it's incumbent upon us as information providers to separate fact from fiction. And hence we started taking up, at least I started, conceptualizing these shows around myths versus real information. Bring in the people who have a locus standi to talk on it. So say when you talk about when somebody is going out of breath, what do you do? So I used to get a panel of doctors to explain to them that, look, proning is the way to go, or, call up your healthcare provider is the first thing that you need to do. Don't do these ghar ka nuskas at home, or things that you're receiving in WhatsApp are not true. There was too much vaccine hesitancy too. Many people spreading a lot of myths about vaccination, and we had to get the right kind of people. So we had that particular reach and brought all those people together with various different topics. I've just listed 3-4. So there were just so many through the pandemic that I can't list here. And we conceptualized the show and started separating fact from fiction and bringing out real information for our viewers, so they don't buy into any of this misinformation that's so rampant on social media, on WhatsApps, on hearsay. There was a lot of fear mongering that was going on as well. It was taking a toll on people's mental health. And being a mental health mentor, I know how badly it can take a toll. And hence, I started doing a lot of shows that help people deal with grief, with the anxiety, with survivor's guilt, with loss. There's just so many topics. So we took them upon ourselves to allay fears, one, to stop the misinformation, two, to bring them the facts as they are, three, and do news that they can use during the pandemic. Nobody wants to listen into blame game at that point of time. That time, nobody cares whether this party is doing this and that party is doing that. That time, all that you need to care is about what is the news that I can use and how can I help my immediate family if we are suffering. Hospitals were running out of bed. There was lack of oxygen. There was, in fact, even when Delhi completely ran out of oxygen, many hospitals ran out of oxygen. We also realized that the minute the hospital owners started putting out those tweets, we used to get in touch with them and ask them what happened. And they used to say, hey, you know what, we just have 2 hours of hospital left, oxygen left, and we don't know what to do anymore. And then, a tweet going out from a verified Twitter handle like mine or my colleagues or people who, were mobilizing resources, along with the fact that we used to verify these stories, put them on air and say, hey, this particular oxygen requires your attention. So listen in. Authorities, please listen in. And when that used to go out on mainstream media, action used to be taken. And one by one, for every hospital that faced a problem here in the national capital or in other parts of the country, they started getting in touch with us. We started taking those stories on air. We started questioning the authorities. We ended up, in fact, off air also ended up calling a lot of these authorities and saying, hey, what are you doing about it? Because, there was this, I remember still, that there was this one children's hospital that ran out of oxygen completely, and there were premature babies on oxygen support during COVID times. And I got a call of cry from the management. There was another hospital owner who was in absolute tears saying that I don't think my patients are going to survive like this. So we, even offline, outside of what we do on air, of course, we took the stories on air, started calling up and trying to solve the crisis. And we got, from wherever we got support, it's party agnostic, it's whatever, right? Whoever was in authority gave us support. We took that support at that point of time. The whole idea was to make sure that the oxygen is sent across. Then I got in touch with a friend of mine who runs an NGO in London, who called me up and said, hey, if you need resources mobilized, I'll send them across. So I said, at the moment, we just require a lot of oxygen cylinders. There were people who were standing outside of hospitals waiting for their turn to come, running short of breath, gasping for oxygen. So there were cylinders that were required to be even sent to them when they were sitting in cabs outside hospitals, right? And the hospitals were not being able to provide it because they just overburdened at that point of time. So through this NGO, we mobilized a lot of cylinders that we brought in, and we used to just send out these cylinders to whoever reached out to us at that point of time, because in the nick of time, you provide that person oxygen unless he or she gets admitted. At least something is taken care of, and even few lives, if they are saved, it's good. It's good. I mean, that's all that we wanted at that point of time. So on multi-pronged process, certain NGOs step forward to help with ration. So we mobilized the ration wherever it was required in our personal capacities. There was Tehseen, who was very closely involved with me as well, Tehseen Poonawala, and Situ Mahajan Kohli, Leher Sethi, there was Tanika Thakkar. All of us got together and just whatever anybody required, having the wherewithal and connections with the right hospital owners and knowing who needs what the most, we used to just start helping them out without worrying about, we used to say, worry about your finances later. You fall short, we'll make sure we get some Samaritan to help you. First, go get yourself treated. First, save your family member. And we just got involved. I mean, we just couldn't see the suffering, and we just got involved and started doing this in every little way that we could. And being on national media, we always had that platform to highlight these issues, bring them in the public eye, putting pressure on the authorities for them to act as well. And that happened.
Yes, definitely. The media pressure did, raise issues of accountability as well as the courts. They also played their part. Sandhya, you worked during the first wave, during the second wave. Did you see any difference in the state of migrant workers? Also, the kind of people affected by COVID, did you see a difference in the first wave versus the second wave? You feel there were X people who needed more help as opposed to Y people between the two different waves?
So when we dealt with the first wave, it was new for all of us. There was a lot of panic. It's needless to say that we were trying to figure out resources. That's how from the ration drive, we came to the bed resources. We realized that there was a real-time gap that was needed to be filled when people were out there and not feeling well in the ambulances. There were hours, like 4 to 5 hours, when they would stand outside the hospitals, not knowing when they would get the bed. That is how SOS Saviors was born in the first place. I and Dial 4242 ambulance service, the co-owner of that, Jitu, is a friend, and we both started this together in the very initial phase. And slowly we added a lot of other change makers, as I call them, to join the league. And we realized we needed help with medicines, real-time update on hospitals. Where do we find the beds? If you ask me the stark difference, Anisha, here, there's one thing that we thought second wave will be extremely prepared because of what happened in the first wave. But second wave in itself was not less of any other panic. I mean, there were days when, like Chaiti said, since we are all on Twitter, we would have interacted once with each other, some case or the other, and it was a panic situation. We were talking about cylinders, going down, trying to talk to agencies, getting refills done, helping the hospitals. The narratives really, changed from whose responsibility to our responsibility. It became all of us together as a partner. And this should have been different, right? Looking at how we managed first wave, we could have been so much more prepared. Either we took it too lightly when the gap that appeared when the cases went low, we were too confident that we would never be hit with this again. However, Mother Nature has her way of teaching us our lessons, and second wave came in very abruptly, and we were still underprepared, irrespective of the centers we had and the hotlines we had. We were facing here in Maharashtra or in Mumbai to speak with. We had our own, COVID triage calling and all. But again, there was a gap that had to be filled in because there were so many times when information or hospital bed availabilities became very little to not at all available, and in such a panic mode when you have someone calling you because in the first wave you've helped say 100 people you've helped, they've spread a word out to another 100 of their friends. So everyone has our numbers now, and they all call us with so much expectation saying, you can do this, probably not someone else. So we realized that the public government partnership that was needed, NGOs stepping up and, volunteer initiative like ours coming forward and saying, let's do this together. And very little pinpointing happened at that time, more of solution driven initiatives like Jyoti mentioned, including people like Tehseen or all of our volunteers who are there in various areas. We have Dr. Yogita in Pune. Here we had teams of KWF, like Kidney Warrior Foundation works for dialysis patient. I'm a part of that family. And I realized the dialysis patient had no clue if they were COVID positive. They had reservations. They didn't know where to go. They didn't know what is the availability. Some of them couldn't afford private hospitals. So, what were the reservations in government hospitals or the COVID care centers? All of this information gathering is something that we invested ourselves in. We realized that we can give the answer to people when they, don't find any help at that particular time. And even at 2 a.m. in the night, 3 a.m. in the night, ensuring that we can, really help. So, if you ask me the difference, no, we did not have any less of a trouble in second wave. In fact, it was 10x more with the cylinder concentrator issues. And what I experienced is there are still vulnerable groups like the cancer patient, the dialysis patient, who did not find the right one. Even today, when we talk about vaccination, there are times when dialysis patient vaccinations were a concern because 18 to 44 was not permitted. And here we're talking about kids who have severe, kidney ailment.
Kidney problems.
Yeah, if they stand in the queue, they're overexposed to a lot of other infections, secondary infections. So these kind of healthcare issues, very minutely, we could address because we are in touch with doctors, NEFs, we are in touch with these NGOs that work towards these specific programs. We conducted, so there was a point when plasma was disputed, but then it was recommended by all hospitals, left, right, center. You had one patient who required 7 to 8 plasma bags at certain point in time. So we had to kind of, make sure that these gaps were filled and step in and do our bit, whether it's donor initiative, talking, counseling. And now that the third wave is something that's being discussed, my question is, are we still extremely prepared for everything that's coming our way? At least
Who
we.
knows? Many, yeah, even some of the hospital administrative staff that joined us today were not sounding very confident that, uh, there's one thing about management and administration not being, ready and up to the mark. But both of you have spoken about the information asymmetry and the misinformation. So, how critical is this? Because, the virus is new, Chetty. The recommendations are also changing because of how it behaves. Now the Delta Plus is being painted as a really vicious variant. So how do people filter out credible news from the misinformation? And is it really important Do you think mentally people get affected because of what they keep hearing about COVID?
Well, yes, misinformation is dangerous, so much so that it can cause deaths. Because when you have somebody coming up and giving you wrong information what to do when it comes to an emergency for a patient, and you tend to bank on the misinformation that you've got, it can lead to death in a pandemic, and we've seen that. We've seen many cases of it as well. And hence, it's, for media, it is very imperative that our job at that point of time is to be information providers, proper information providers, verified information providers, not put out anything out there in a hurry, not be very trigger happy with anything that comes our way. Even at our news channel, we have several layers of verification that take place before the actual information is being vetted out. In fact, if you see certain doctors, they've also changed their stance over the course of the time, because at that point of time, nobody knew. During the first wave, no one knew what to do, what the protocols which is being made. By the time the second wave happened, there were different set of protocols. The protocols eventually changed for plasma therapy. They changed for ECMO support. They changed for, who requires plasma, who doesn't require plasma, the non-judicious use of steroid and what it could do. And we saw the cases of mucormycosis on the rise because of the non-judicious use of steroids. So it's not just misinformation at people level, it's also misinformation at the doctor's level. So all of this research that comes in, the WHO practices approved that come in, the new ICMR guidelines that end up coming in, it is our job and incumbent upon us to keep our viewers updated, and that also includes medical professionals and everybody else who were listening into knowing what the latest notification really reads and follow that the new protocol that is coming. Because look, it's dynamic. It's still dynamic. We're in the second wave. The Delta Plus variant is around the corner. What we did in the second wave and how the medical protocols existed may or may not exist in the third wave to come as well. Do we know the virus better? Yes, we do. But do we know all the protocols of how to handle things better? Probably not. And the research is underway. Research is undergoing, and hence, for us, that kind of verified information that comes in, it's very important to keep playing it out as and when it comes out, so that people remain informed. Misinformation can be very, very dangerous, so much so that there have been instances, I don't want to name anybody or anything, but there have been instances where lives have been lost because of misinformation. Hospitalizations have been delayed because of misinformation. Medications have been given wrong because of misinformation. Plasma has been given out at the wrong time without following protocol because of misinformation. People have taken it easy and not approached their medical, because in the first wave, it used to be like, okay, it's just another flu and you'll get over it. Take your antibiotics, take your medication, and they have that set medication. You take that and you'll be fine. And that was okay in the first wave, but the second wave was far more deadly. And hence, medical supervision became all the more important. Then we found out in packets of certain state governments, they were doling out steroids like they were doling out paracetamols. And that became important for us to highlight, because the non-judicious use of steroid was causing black fungus in patients. Then came the black fungus issue. And in black fungus too, people were getting scared. People were anxious at that point of time, because all of a sudden somebody's eyes getting removed, somebody's partly your face is getting paralyzed. All of this, then we had to bring on the medical professionals on board, not just from India, but from all over the world, including epidemiologists and virologists who were working on understanding the genome sequences of the viruses and stuff like that. And we had to really pick and choose right to these universities. So we had people from Johns Hopkins, we had people from different universities over the world who were doing massive research on this, come on board and keep educating, keep updating what the latest research is saying, because what was true as of a month back is not true now, given the way the virus is also mutating. So we have to keep a track on everything that's going on.
Right, Jesse, do you think that people should then rely on mainstream media more than WhatsApp forward? Very short, because we're coming towards the end. In brief,
do you think people should rely on mainstream media?
Mainstream media over WhatsApp messages that keep circulating.
Rely on credible news channels. Rely on credible television and credible digital news networks that stand for credibility. that stands for authentic news, that stands for responsible news dispensation. And yes, do not believe whatever you see on social media platforms or random messages that you end up receiving.
Get a second opinion in the information as well. Now, we're coming towards the close of this discussion, but now there's this one thing that I want to ask both of you. Sandhya, let me start with you. Now, you have done what you've done on a personal level. Okay, you've helped people with rations, you've helped people find infrastructure, beds, oxygen, whatever. You've done this on a personal level. Has the experience frustrated you? The administration, the lack of facilities, has it led to this frustration? Do you want to now perhaps have some amount of activism that we should have? It's time to start questioning. We can't just say कि अब वो time निकल गया चलो अब सब ठीक है. After what we see, should we now question? Will you, from a good Samaritan, become an activist?
So, Anisha, part of our entire social work has been questioning time and again of all the failures that we've faced. Because, see, we are also people who are partakers of the journey of anyone who's got affected by this. And in fact, in doing service to them, we are also facing the brunt of lack of resources or lack of information. So, whenever we found issues, we've raised a voice. They've given out interviews where we could, whatever medium or platform we could use to raise our voices, even talking to authorities, meeting them. I would say that there is a lot that goes into at the administrative level. They're also putting in efforts. Of course, we can't say that it's only us all the time. They're also putting in efforts, working hard. There are doctors. I want to take this opportunity to really thank the medical staff, the doctors. I can't tell you the number of times I've probably dialed a doctor at 4 a.m. in the morning. They've woken up, they've guided, they've helped, and I see them toil in the PP kits. And there is, of course, there's a good and bad side to both. And whenever we face the bad, we raise it up, we take it up with our fellow media, fraternity, and they've written stories of whatever feedbacks real time when we've experienced an issue with a hospital or administrative flaw. They've taken it up. Next day, there have been news pieces. That's the only way we can address it, of course. And the thing is, how soon can you act upon it? Because when people like us, the social workers or the activists or people like Chepi who use their platform and the blue tick to ensure that the dissemination of information is faster, quicker, there's more response. They need to understand we're doing this as a team and not see us as, people who are trying to belittle their.
Adversaries.
We have to believe in public government partnerships. Going forward, we cannot say that, like, there was a point in time when we had the BMC tweet that none of the other people, the NGOs or the volunteers, are permitted to help people in guiding them for beds. But the information lack that has happened at their end is what caused us to step in the first place. We wouldn't want to do it if everything is smooth and in place. So there are times when, of course, there are administrative officers, the ward officers who really help us day in, day out. I just hope that it is right across the entire system and we're more prepared for the coming third wave. And one more quick thing that I want to add, Anisha, is we're talking about the city life here. The rural spectrum is very different. They're going through a hell lot of issues right now. SOS Saviors, my team, we're working at doing an initiative in Palghar because we have an Adopt a Village program where we want to go to the rural belts and ensure their deworming is done, their vitamin deficiency is taken care of, the education bit is taken care of because now everything is digitalized and they are obviously too new to it. We've done a lot of phone drives and all. But in doing this, when we were talking about villages, the first thing that came to our mind is, interiors of Maharashtra is where we have to go. But you go 2 hours driving from the heart of the city of Mumbai and go to a belt in Palghar, deep inside, and you see there are houses with no lights. So there is a solar lamp initiative we are doing right now. But now when I'm thinking of it, these are still issues that we're facing without COVID in the picture. As soon as the third wave hits, how prepared are we to take care of our rural brethren? Are we giving them enough medical facility? Are we prepared to address their issues? Because smaller hospitals, last when we were talking, they didn't even have oxygen concentrators in place, and they were like that. At
Yeah,
least,
and the second wave still continues in many parts of rural India and in northeast India, where the situation is really not completely under control.
yeah.
Chetty, earlier in the day, we had a few hospital administrators saying that the situation in Delhi was such that the mismanagement was quite severe, and that really impacted hospital functioning. Now, they on their end can only do as much. They claim that the government is not in a consultative mode to consult with hospitals and then come out with a plan to fight the to prepare for the third wave. They say we only get orders. कोर्ट ने बोला, कोर्ट ने फटकार मारी तो सरकार ने हमें ऑर्डर दे दिया, हमसे तो पूछते नहीं कि आपको क्या चाहिए. So do you think it's time for the media to now start questioning on what is the preparation for this wave three?
We are doing that, and we are already doing that. If you see our channel, we're running a lot of stories to that regard. Just recently, we highlighted the crisis at Bayanad as well, and Sonu Sood stepped up and helped us resolve it as well. And I think our stories have made a lot of impact. The media is doing its bit. I don't know about what everybody else is doing, but we are doing our bit. All the questions and the right questions always will be asked and continue to be asked. I also want to take this one moment to even say that, look, in a pandemic, there's a lot of confusion. Everyone's dealing with it for the first time. It's not fair to just keep playing a blame game, even as media all the time, because this is not the time for blame game. Yes, ask questions, hold them accountable, hold everybody who's in power accountable, and that is our job. It's our first job, and we continue to do that. But at the same time, I think altruism plays a very big part in the pandemic, and humanity has to come first. And given that humanity has to come first, say if a hospital administration feels that they lack something and they require our help in our personal capacities, I know many of my colleagues also who have stepped up and helped them the manner in which they can, which we will, connecting them to the right authorities and getting them the right help from authorities. The authorities, most of them, I can safely say and proudly say, have been really very cooperative. There have been massive loopholes in the governance which have come to the fore, which is for everybody to see. Those will be questioned, and with our questioning, hopefully they will be resolved, and hopefully they will be better prepared in the third wave. Only time can tell whether they are or not. I'm not too sure of that. Having said that, I just want to give a big shout out to the likes of Sandhya, to the likes of Tehseen, to the likes of many others, who have been relentless in their pursuit, in their effort, shown the world how together we are stronger. And it is only altruism that helps. When I was working during the pandemic, I didn't think of myself as a journalist first. I thought of myself as a human first. I did everything, whether it was doing my shows on air or whether it was helping people out. It was me being human first, and then a journalist, and then everything else. So I just feel that while there are a lot of questions that still remain to be unanswered, while there are a lot of impediments that hospitals will encounter, administrations will encounter, even in the third pandemic, but the idea and the messaging is cooperate, understand, help each other out, stand by each other, don't get bothered by the chaos that is going on. And yes, there will be chaos. There will be chaos again when the third wave hits us. Each and every one of us, if we start getting a little more empathetic and sympathetic to others, I guess we can overcome anything under the sun. We've done it before. We can do it again.
Okay. Amen to that. Let's hope and pray that our humanity will save us, that we'll stand together with each other, to help each other in the time of crisis. I want to thank Sandhya and Chetty, both of you, for coming here and sharing with us the work that you've done. The work is really exemplary. To give hope to so many people when they have lost all their hope is really tremendous. Thank you so much for joining us. We want to present you with certificates for taking the time out for Gratitude Week, and that's a certificate for Joe Chetty. Thank you so much thank you so much for coming here and sharing with us your experiences. And there's a certificate for you too, Sandhya. We appreciate all the time that you've taken to speak to us, to narrate what you've done, and keep up with the great work that both of you are doing. Congratulations and thank you both for joining us today. It's a pleasure to have spoken with you, and you inspire so many people to do more than what they think they can. We can be limited by our thinking, but once people see both of you, I'm sure they'll also learn to think big and help everyone so that our humanity wins.
I also
That's
forgot
all.
to thank. I also forgot to thank all our doctors and frontline workers out there. I think they deserve a big salute. Big salute. I mean, there's no words can do justice to how they've really given up everything at home to just be there for the sake of humanity. Thank you very much to all our doctors and healthcare workers.
Yeah.
Thank you, Sandhya. Thank you, Chetty.
Thank you.
This is our marathon, a whole week of Thanksgiving for our doctors who truly deserve it. Thank you both for joining us. We'll take a little
Thanks.
break at this point in time, and we'll return at 5 p.m. with another session. Join us again.
Thanks.
Bye-bye.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया.